This open meeting of the Triton Regional School Committee is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, and the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the Governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. I hereby call to order the July 29th meeting of the Triton Regional School Committee at 7 p.m. I'm Narissa Wallen, Chair of the Triton Regional School Committee, and I would like to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Erin?
I'm here and I can hear you.
Thank you. Paul Goldner?
I'm here and I can hear you.
Thank you. Maureen?
I'm here and I can hear you.
Thank you. Caitlin?
I'm here and I can hear you.
Thank you. Paulise?
I'm here and I can hear.
Thank you. Linda?
Here and I can hear you.
Thank you. Paul Mayette?
I am here and I can hear you.
Thank you. And I think we said Tina is not here, right? Yeah.
She's attempting to come in. Now she's listed twice. She's joining on 2 different devices and it seems like she's having trouble, but she is popping up any moment now.
Okay.
Technology bugs are out tonight. If you want to keep going, I'll watch for her and let her know.
Yeah, I can do that. And I don't think Kaylee has joined either.
She has not. No.
She has not. Okay. All right. Staff, when I call your name, or this is staff and persons anticipated on the agenda, please respond in the affirmative. Brian?
I am here and I can hear you. And can I also say, Tina just noted she is here. She's without the video.
Okay.
She said she's here and she can hear you in the chat.
Okay. Kyle?
I'm here and I can hear you.
David?
I'm here and I can hear you.
And Deb?
I'm here and I can hear you.
Thank you. And Pam?
I'm here and I can hear you.
All right. Thank you very much. For this meeting, the Triton School Committee is convening remotely via Zoom using the information posted on the district's website identifying how the public may join. If you are personally attending by video conference using your device's camera, please be aware that others may be able to see you. Committee members and administrators, please remember to mute your computer or phone when you are not speaking. All supporting materials that have been provided to members of this body are available on the district's website with the agenda posting unless otherwise noted. The public is encouraged to follow along using the posted agenda. Each vote taken in this meeting will be conducted by a roll call vote. Please note that this meeting is being recorded and that anything that you broadcast may be captured by the recording. So we are moving on to chairman's comments, and I don't have many tonight because I just saw you all 2 days ago. But I just wanted to say thank you for the time that you spent this week. I know there's been a lot of information that's been coming your way, coming at the reopening group. The administration obviously is handling a lot of information, and we even have more new within the last couple of hours. Just as a reminder to those that are watching, this is a meeting of the school committee and the administration in public. There is a public comment period, but during the rest of the meeting, you are literally watching a meeting going on. It's not something that you can participate in. And I'll open the public comment in a minute and give you some instructions on that. But we'll ask you, not to unmute. Obviously, we can remute you if we need to, and not to use the chat during the public comment section or during the regular agenda items. That said, let's move on to oral communications from the public. The next item on the agenda is public comment. Members of the public, the meeting host muted you as you entered the meeting. If you would like to address the committee, please indicate now that you would like to do so, either by using your hand on your video call, using the raise hand option on the participant screen, or using the chat option. The meeting host will unmute you so that you can address the committee. Please refer to the public comment policy language on the agenda when making your comments, and remember to speak clearly and in a way that helps generate accurate minutes. When you have finished speaking, the meeting host will mute you. And I'll just read aloud real quickly. Members of the public may address the committee for up to 3 minutes, longer with the permission of the chairperson. The committee will not engage in a discussion on topics raised during public comment, but may choose to add the topic to a future agenda. This agenda segment will be limited to 15 minutes unless extended at the discretion of the chairperson. Is there anyone here that would like to to address the committee? I am not seeing any hands. All right. Moving on, the next item in the agenda is the fiscal year 21 September reopening and budget implications. And we are very lucky to have here tonight Deb Rogers, who is the Newbury Health agent, and Pam, who is the Newbury public health nurse. Do I have that right? All right, public health nurse. So this is something that the committee had been asking for a while now, because obviously, as I heard Brian say many, many times in the discussion, the community discussions over the last couple of days, none of us are doctors. So we've been researching science, we've been making decisions the best we can, we've been reading all the guidance that's coming from DESE and their kind of reasoning beyond that. But I know that there were a lot of questions that particularly came up during the discussions that we've had, things like how contact tracing works and things like that, that exist kind of outside of the school district. So thankfully, Deb and Pam made the time to come here tonight so that we can air those questions. And I don't know if Deb, do you want to give a little introduction on kind of your role and Pam's role in the process so that we know sort of where you fit in the giant puzzle?
Okay, sure.
Thank you.
So myself as the public health director, I more so enforce and follow and help anyone understand the guidelines itself regarding COVID-19. So any kind of mandatory, whether it be face coverings or social distancing and things like that, that's pretty much my role in it. And then Pam, who's a great public health nurse, she's the one who does the contact tracing and, and she could explain it more, but does all the determining of who's been exposed in isolation, quarantines. And then from there, after she does all what she has to do there, when we get a positive COVID-19 case, she lets myself know because, and that information is only by address. She only gives me the address, not names of who it is. And that way our first responders would know that that house is a COVID case, and therefore they could be aware of it. And that's the only information I receive myself is regarding that. So there's two different roles in the COVID-19 pandemic. And one is, again, the guidelines, making sure that, we're following everything, like all the governor's orders, and things are evolving and changing constantly. So, and same with even the contact tracing and Pam's role as, checking into the Maven account, which is where every positive case goes in Massachusetts, and she follows that. But things are evolving. We could tell you something today and it could change by the time we're off of this call. And that's the part of it that we'll try to help in any way we can answer questions. And we'll also tell you that some of the questions, I actually had a meeting this morning with the superintendent of Georgetown, because I also do, we both also do Georgetown, and Pam does Ipswich also. So knowing that, what we've done is taken any questions that we can't answer, writing them down, bringing them back to the Massachusetts Department of Public Health, and finding out if we can get those answers answered for you. And even for them, they don't have all the answers yet either, which I'm sure you can see too with, even DESE. So we're all trying to work together and get the answers, but unfortunately we don't have them all. So we'd be happy to help answer any questions that we are able to.
That's terrific. Thank you very much. I don't know if someone wants from the committee, or sorry, Pam, did you want a chance to talk a little bit more about what you do, or you're muted? Zoom's like a whole experience.
There you go.
Yeah. So, I think Deb explained it. The Massachusetts Maven is, the Massachusetts Virtual Epidemiological Network, which is sort of the platform we use that's connected with the state. So I will receive any confirmed or probable COVID cases as well. That's what we're speaking about now. I also do lots of other communicable and infectious diseases that come through in Newbury residents. So there's a whole process, just like Deb said. I'll get notified of it, name of the person, I'll interview them, make sure, find out when their symptoms started, when they were tested, put them on an isolation protocol, and then find out who their close contacts were, who would then be quarantined. So I know there's some, we can speak to this later, there's some differences between the way we have been quarantining individuals that are close contacts and the way the DSD has specified how the schools will. So I think some of that is still being worked out. Yeah, so hopefully that helps a little bit.
Thank you.
Perfect. Thank you very much.
Well,
And I guess I'll open it at this point to the committee for questions, because I know there were quite a few over the last few meetings, as you can probably imagine. Who wants to go first? So I guess I'll toss one out there to start with, which was kind of a big one, was that in the guidance that we received, it says that the family will actually notify the district of a positive if there's a situation where someone has tested positive. And one of the questions was if that doesn't happen right away for whatever reason, it could be somebody that's obviously very ill or whatever, how quickly does the district get notified kind of outside of that individual or that family notifying the district?
Jeff, you may.
Yes, I guess whoever can answer it. I'll leave you two to figure it out between the two of you. Who's the right person?
Well, let's see. The system is set up in a way that when there's a positive result, so someone is confirmed, and usually all of the labs are sort of linked in to Maven. So when a positive result comes in, I'm going to see that as soon as that result is available. At that point, I know about it. So they're usually, when I contact a person, the family usually does know already. So they may have gotten contacted by, their physician or through their portal or something to find out that they were positive. So I'm not sure. Are you sort of asking like, yeah.
So can I rephrase the question?
So what?
I was going to rephrase the question. I think the question is, so if a parent doesn't tell us, will you tell us?
Yes.
And how soon does that happen? Because I think there's the concern, just like everything else, right?
Well, I mean, I'm on a day-to-day basis. So like so far, anything I see that's positive, Deb and the person knows it immediately. There hasn't been a lag. Let's hope it stays that way, right? That we're able to keep up with it in that way. Typically, I would be notifying the individual that was positive, but maybe we need to set something up where I'm communicating with with the school nurse. Would that be best? I'm not really.
Yes. Yes, I think so. And I think
Right.
I know Claudia Small is here. I think there's other nurses having traveled with the link, but I think absolutely, I think that's the key. And obviously, it would be you, Pam, and Deb for Newbury Elementary and for the middle school, high school, and then obviously working with Jack and Tina, the new public health nurse, and Frank, and I'm not sure who the public nurse is in Rowley. But absolutely, I think that's the concern, is setting up those protocols so that we certainly we trust that everyone will tell us right away, but we want to make sure that we know as soon as feasibly possible.
I was just gonna kind of go on with that with Pam, and we have had a few glitches throughout, since March, and one of them being that this can happen, and it's happened many times, and that was where of course the family is notified first by the doctors, and it could be a day or two before we actually get notified, correct, Pam? And we've seen where she'd be like, it's not even in Maven yet, but the people already know about it. So sometimes that does happen where, the patient may know and we may not know for another 24 hours after that. And then there's sometimes there's situations where the information given to Maven, the contact information, we have had to call the police station to find out phone numbers. And so it's not 100% accurate. So there is some glitches that we may have along the line that, may need to be sorted out. But as soon as she gets the information, she starts on it right away.
And there's no HIPAA concerns, you're able to share that information with the school.
I need to,
That was a question you're hoping I wasn't asking. Sorry.
Yeah, I'd like to, yeah, right. And what do you think, Deb? I need to look into, you know.
So that was asked this morning's questions too, and that is a question that it has not been worked out yet. I do believe the nurses can speak to the other nurses,
Yep.
but I don't believe, I mean, the same with, like, we can't even tell first responders a name. We have to only give the address. So that's something that Mass DPH and DC have to work out and figure out in HIPAA and find out the law on exactly what information Pam can actually give. Right, Pam, if I'm correct on that. So that is a question that's on my board. As soon as, I mean, I've been literally emailing the director of the Department of Public Health on a every other day basis, as you know, governors has been asking a lot too, and all the others. And every email I send, they say, we're working on this, we're working on this. So they don't even have all the answers yet on that, but the HIPAA is definitely one that we have to fully confirm before we give any of the information out.
And the other thing is too, if I'm you know, I find out about a case, I interview the parent likely because they're going to be a minor in the school system. I can also relay to them at that moment, just like I would if someone, like, you know, worked somewhere. I would say, you need to notify the school. So there would be a, you know, at that point, there would be a communication point where I could say, notify the school now. And that would help with the HIPAA as well, because it would be coming from the parent directly to the school nurses. So,
Okay, thank you. I know, Linda, did you have a question before I? Linda's thinking. Did you have a question? Your hand was up and then it went away.
I think she's trying to unmute. There she goes.
And she's trying to unmute. No,
Right,
not working.
Okay, you keep
All right,
trying to
well,
unmute. Go to
Yeah,
Maureen.
you keep trying to unmute. I was just going to say that Maureen has a question, so I was going to let Maureen go and then.
So I guess my question then would be about quarantine. So say we have a student in one of the elementary schools that tests positive, and that child has a number of siblings in other grades. There's a lot of questions about how would the quarantine work? Does the entire class quarantine? Do you have to reach out to the siblings classes and have those classes quarantine? So I'm just hearing a lot of questions from parents about, you know, what would happen in the case of a child, you know, coming down with COVID and having, you know, siblings in other grades.
Pam, you're muted again.
the learner.
There you go.
Sorry. What I could speak to with that is that if you have a confirmed case, that person is going to have close contacts that will be put on quarantine, which would include likely their siblings because they're living in the same house in a close space. So those siblings would be, you know, close contacts put on quarantine. But at least the way things are now, I don't know that they'll change, we do not then quarantine contacts of contacts, if that makes sense. So you're not going to then quarantine the sibling who is a contact of a confirmed case. You're not going to go say, oh, well, the sibling was playing with, you know, 3 friends yesterday. That's a little bit too far. So if that, I don't know if that answers your question, but I think it draws a little bit of light there where you're looking at the person that is a positive and who was around them and quarantine them. Now, if they become positive, then that does that make sense?
Yeah, no, that makes sense. So would it be the same if the teacher, the teacher of the class would, I mean, is there any difference if a teacher is positive for COVID? Would the class have to quarantine?
Right.
I guess I'm trying to understand if there's a difference between the kids and the teachers.
Well, I guess I'm going to say the 3 most important things is that people should have masks on. They should stay 6 feet apart, although I know there's a 3 foot
Not in
protocol.
Triton.
Yeah.
What's that?
I was gonna say the
I was
committee
just gonna
voted to
say,
use 6 feet.
we're actually opting to use 6-foot guidance.
Fantastic. So fantastic. So if you stay 6 feet apart and you wear a mask, right, and someone in the classroom is positive, but you have maintained those measures, I don't know if it's different in the schools, but from in the public realm, that person would not be considered a close contact. So that's how we determine who is a close contact of a confirmed. So if the teacher is positive, has he or she been maintaining that distance throughout the day, and do they have masks on? You know, those are kind of like the two, if that makes sense. But if that, you know, if that isn't maintained, then I guess you would say, well, then yes, the classroom is going to need to quarantine, right? If they were, you know, they're together the whole day, and if they aren't able to say that, you know, they never had more than 10 to 15 minutes close together, I don't, yeah.
So I think the DESE guidance is a little bit different, and maybe Brian can clarify on that.
Yeah.
But I believe what I read was that if it's an elementary school in a self-contained classroom, that because of the prolonged exposure, even if it's 6 feet in mask, they are considered. Is that correct, Brian?
That's correct. I was gonna say, yeah, so it's
Yeah.
in the school setting in general, it's exactly what you said, Pam. And the caveat, in an elementary classroom, we're assuming the class is self-contained with the same teacher or teachers and the same 18, 19, 20, 21 students, and they're spending 6.5 hours together every day, then they're considering that whole cohort, teachers and students, close contact regardless. If you spent the day together, you're considered close contact.
And is that just at the elementary level? Will that be the same in the middle school, high school as well?
So it's any self-contained classrooms, which is only at the elementary level. So at the middle school and high school, and even upper elementary, they departmentalized, and so you're changing, you know, 3, 4, 5, 6, 7 times a day. So that would not be. Then it would go to the more standard definition, like you were explaining.
Understood.
Yeah.
Okay.
So I guess my question, just as a follow-up on Maureen, so if I'm understanding this correctly, you quarantine based off of close contact of someone diagnosed. You don't quarantine based off of a close contact of someone who was diagnosed, right? And then, so that's correct. So then is it also true that you don't quarantine based off of a suspected case? Even if that suspected case is a student or teacher in the classroom.
So when you say suspected, I know, because I have that as one of my questions for you. Do you mean that someone was in the classroom and they're exhibiting some symptoms of COVID, but we don't know if they're positive or not?
I would think.
Is that what you mean by suspect?
I think that's the way I was interpreting it. Yes, I'm sure there's probably also, I think, a suspected case at the state level, you know, through Maven, where waiting for a result or what have you.
Waiting for a result, correct.
Okay.
Yes, correct. Let's see. So
when you say scenario, right? So we have a couple nurses on the call. So teacher calls down, says, you know, so-and-so has a tummy ache, sends them down to the nurse, kindergartner. You ask some questions. It sounds like, you know, a regular bellyache, right? If you've got, and I think I've used this example a few times, you've got another student, I have this weird, I can't smell or taste anything, and my stomach hurts, and it's starting to spike a fever. Obviously, that's a very different thing. So at that point, if it's suspected and the nurses are saying, okay, this child's in the COVID room, right? We have to have the COVID space. The appropriate response there, and again, I know what DESE says, but I would love to know what real public health nurses say about how do we respond to that in regards to the classroom from where that child came.
I understand.
And can I just say too, we're not looking to put you on the spot. So
Yeah.
if the answer is, I don't know, that's totally fine. I would rather
I do want to think about it a little bit. I do, because I know that there's such implications for the answer to that question, you know?
Absolutely.
So, Do you mind? I'm sorry, I know, but I would like to think about it, talk to Deb, talk to epidemiology, just make sure I understand. Yeah,
Yeah.
because I don't want to give you, I don't want to give you false guidance.
No, that's,
I-
we appreciate that. We have
Yeah.
plenty of that.
PM, I'm writing all these questions down to add to continue from this morning's questions. So again, these are great questions that I don't even know if the state will have the answer, but I will throw them all out. And if I get them all out by tomorrow at 4, they're supposed to guarantee all the answers by 9 a.m. on Friday morning. So let's see what happens. But as long as I get all these questions in, we should have hopefully some of these answered, because these scenarios are great questions, but it's very difficult that we have two different, on a state level and federal levels, two totally different guidelines. So our guidelines are so different than yours that, we really don't know the answers to some of them. So again, I'm going to write down anything we don't know, and I'll shoot it out to everybody, or shoot it to Brian, and he can shoot it out to everybody.
Yeah, and I think, Deb, too, is that, we've had this discussion about, I had been chatting with you, so we invited you to come, but we also have Jack Morris and Frank and Rowley. And I think to get the 3 health agents with the 3 public nurses, I know Tina LaCourse is the new health agent and also, or a public health nurse and also a parent. So she was on one of the calls. So I think that, we want to make sure that our approach, we agree this is the approach. I would assume it'd be more restrictive than, DESE or perhaps, but I think that, I want to make sure that we have a collective agreed approach based on best medical professionals and not just any of us who are non-medical professionals. So I appreciate that. Yeah.
Yeah, I actually spoke with Tina today, and I got introduced to her. She's
excellent.
She seems great. And we were just saying that it seems like it would be important, and I agreed with her, that, Raleigh and Newberry and Salisbury, since that's who you represent, right, that the messaging is the same.
Yep, absolutely.
For parents and for the school. So perhaps the 3 public health nurses and the school nurses could, come together. So that we know that we're approaching everything the same, because I don't want to be calling a parent and giving them different information than they're receiving from the school. Yeah, we want it
absolutely
to be right and
great.
Thank you. Paulise? Lost him on my screen. There you are.
So Pam, I just have a question, a couple questions, and I don't know if this is a you or a Deb question, but do either of you have the authority to declare a public health emergency at the Triton Middle High School campus and order it be shut down if it comes to that point?
I can answer that. So myself I'm just a public health director, and I help, like I said, enforce the guidelines and make sure things are being done right. And then Pam's role is the contact tracing. That would take the board. We have a board of health, and anything like that, the board of health would have to deem a public health emergency, which they absolutely do have that right to do. And they could actually shut it down. Yes.
Okay. And so just a follow-up question, are there any local guidelines for a mandate that would suggest a full return to teaching of the students, full return of the students to the classroom is appropriate, or state guidelines, so that just hypothetically, if there were no reported COVID cases in Salisbury, Newbury, and Rowley for the next 4 months, would that dictate a return to the classroom is one question. And then the second question is, what level of infections across those same 3 communities would suggest a remote learning plan? Do you have any input on either of those questions?
So my opinion on those 2 questions would be, that would probably, I would assume, be the DESE's decision on, if you could go back full time, if that's what you're asking. And if the Board of Health, unless they felt strongly, and because you're regional, I assume that all boards of health would want to be consistent, saying that they believe that the school isn't doing what's in the best interest under public health safety, and then they could, either shut you down or something like that. But to go back full time, again, I assume that, you know, did you call it DESE? Is that what it's
Yeah,
called?
Jesse, yeah.
So I assume that they're dictating exactly at this point what the schools are allowed to do with your options. And it's not really the Board of Health say regardless what the counts are at this time. That's how I'm interpreting it, that we right now, even if you said, look, we've had no new cases in our 3 towns and we want to open fully, it's not really in the Board of Health's hands to say, yeah, let's open up in September and we're good to go or something. Does that make sense?
Yeah, who is your state counterpart? So we have the local Board of Health. What's your state counterpart? Did you say?
Massachusetts Department of Public Health.
Okay, do you know, or could you reach out to them and just see if they have any guidelines about, you know, mandatory benchmarks for either going fully in person or going remote, if they have any suggestions? Because as much as DESE has been helpful to us, we don't always get clear guidance from them, and sometimes it changes. So
Ripping with sarcasm.
We'd like to take a different approach and see if we could get something from the State Department of Public Health on that issue, because DESE is more education related.
Yeah.
And just if the State Board of Health has set out any sort of a guideline so that if in a school like the Triton Middle High School campus, you know, what number of COVID infections would require, you know, the school to go fully remote if they ever got to the point of going either a hybrid or in person. So I don't know if you can reach out to the state, but that would be
I definitely will. I actually wrote this down. So
I'll just add too that piggybacking on that, and that's actually kind of in the last day or two effort that MASS is undertaking, specifically calling for the state, you know, on up through the governor, whatever jurisdiction has to come through, to set those benchmarks. My understanding is the way it would play out, what you said, Deb, is the local Board of Health still, unless declaring that state of emergency and saying you have to close the school, I don't think after everything, all these decisions that have been made about local control, that they would come in to say you and give you or take away your right to do a more restrictive, is that the right, am I saying that the right way, option, but that pushing them to set the thresholds in both directions. That certainly the thresholds for closing would be straightforward, right? If you hit this level, we're closing you down. I think that would be a directive. But then all of the recommended levels to say if you're at 5% or 10% transmission or you know, infection rate in 5 and 2.5 and 1, and to your point where there hasn't been a case in 4 months, you know, if they're developing guidance, I'm pretty sure they would say you should be working towards a full return. So that is also, and I'm sure it's not a bad thing to ask in multiple avenues, but that has been a discussion in recent days, just over the last 2 days, for a push for that from the state. Absolutely.
yeah, I have to agree because I know that we've been able to be more stringent. So like, for instance, the governor's orders when they started reopening specific things, and some of our parks and fields, we waited and we didn't open the day they were allowed to reopen. And so, you know, between the Board of Selectmen and the Board of Health, you know, they've determined that we weren't ready yet for that. So therefore they waited until we had protocols in place and then opened. So I think it would be the same thing if there was something that we felt, the Board of Health members felt, or the Board of Selectmen or even the school committee felt that, you know, the school was in any way, you know, if they felt in any way that it was a public health safety, then we could pull back and be more stringent. But as far as saying, well, we feel that things are safe and we can go and open up, I don't think that part of it, at least I don't believe that we would have that authority or even want that authority on that, so.
Hey, Marissa?
You sure? Any more 31?
Marissa? Oh, just one more question.
Go for it.
With regard to the teachers dealing with paper forms in the students, if they get back to an either in-person or a hybrid platform where they're actually in class with students, what would you recommend they be able to hand out papers for testing purposes, which means they stay in the class, and then the forms that they send home at the beginning of the year that actually go home? Do you have a recommendation about whether those forms should be going back and forth or whether you should avoid that at all costs? And I'm talking about just the transmission of what might pass on paper from a teacher to the students home.
Yeah, Pam, do you have anything on that where it's more medical for you?
Right. I don't know that I have it based on science, I am in terms of backup, but I would probably say the less handling of paper and things like that between home and school and students, I would reduce it as much as I could. So if it's, things can, I don't know. If it could be electronic, I think that would be much better. I don't know. I know like we're going to be hosting, possibly some flu clinics. Like we're going to try to not be having, a transfer of papers between people. But but I'm not really speaking in terms of like knowing what actually is going to be on a piece of paper in terms of transmission. I can't really speak to that.
Yeah, and we have no guidelines regarding that either at this point, but I can ask that question also.
Thank
I
you.
think I was going to say, going off the DESE guidance, the basic guidance is as much as possible, following what you said, Pam, as much as possible, don't let students share anything. So kind of following that to its logical conclusion, I would say as much as we can do, that makes as much as we can do not transferring paper back and forth. I would love that whole stack of paper at the beginning of the year to be electronic. We've made strides toward it, but there's a lot of information on those pieces of paper. So great question.
Paul, are you all set?
And thank you, Nursa.
All right, thank you. Linda, do you want to try to unmute again? Hey, can't hear you. Oh, there you go. Okay.
Can you hear me?
Yes.
Okay. The guidance for whether you're indoors or outdoors seems to be changing all the time. You have the kids that are going to be on the bus and the kids that are going to be in the classroom. Now, Pam, I think you were saying that the kids in the classroom wouldn't have to be quarantined if someone in their class was contacted or came positive for the virus.
Well, I'm going to say that based on what we spoke about with Brian, that's actually not what the DESE is saying. They're saying, so don't go by that. That was more from the perspective of the public, not in a school setting. In the public setting, we were very much using a 6 foot, 6 foot distance or and not being closer than that for 10 to 15 minutes. But it sounds like it's in these cohorts in a classroom where so I think I was mistaken in what I said in terms of in the school setting. I was speaking in terms of outside of the public.
Is the conflict, right?
Yeah.
Mhm.
Okay, thank you. Because I think we have to have some concerns with the kids being on the bus as well.
Mhm.
That even though they're not in the classroom, they may not be in the classroom with any of the kids on the bus, but they should still be counted as those kids. That's all the question I had.
Okay. How far do the children live from school? Like, are they on a bus for half an hour, or is it just different?
I would say pretty much every run is 20 to 30 minutes on average. There's a couple outliers, a couple quick ones where there's a whole bunch of kids that are really close and fill up a bus quick and get to school. But by and large, I would say on average 20 to 30 minutes, maybe a couple coming from the furthest distances over to the high school, 30, 35 at times. Yeah. Uh-oh, is Narissa frozen?
Nope, I'm good. Sorry.
Sorry.
Didn't realize that was the end of the conversation. I got distracted in between. Was that it, Linda? Does that
Yeah,
answer your
that was it.
question?
Some of the other
Okay.
questions I had were answered.
Okay. Paul Goldner?
So if I'm out in public and I'm 5 feet from someone for 10 minutes and they test positive, I should quarantine. Is that how I understand the guidelines?
Yeah.
So if I'm within 1.5 feet of someone who tests positive, am I looking at a shorter time for which I should quarantine, or is it still the 10-minute time frame?
So but let me make sure I understand what your question is.
Yeah.
So if you are, you know that you have been with someone that has the illness, okay? Okay. But you're in very close contact, but for a shorter amount of time?
Yes. Yeah.
I mean, you know, there are some variabilities, I guess. You know, every case is different. If you had told me that and like the person was coughing or actively sick, I would say yes. You know, you have had more of an exposure. But if I wouldn't necessarily say that if you have under 5 minutes near someone, you know, a foot away from you, you necessarily have to officially quarantine. We all should be watching our symptoms and, you know, being very careful, obviously. But I don't believe that there's guidance on what you're saying that would make that different, unless someone was like actively, you know.
Okay, thank you.
Mhm. You're welcome.
Is that it, Paul? Yes.
Yeah, I'm good for now.
Thank you. We have 3 Pauls on the committee, so this is going to get a little confusing. We're going to go to the third Paul, Paul Mayat.
Hi. Thanks for coming out tonight, first of all. Quick question about contact tracing and how that's going to work in terms of cooperation between your role and the school's roles. Obviously, it's going to be on the schools to give you names, I'm assuming, of this, you know, this student were within 6 feet of the student who tested positive. Do you take it from there? Do we need, how much information, how much kind of clerical gathering are you going to need on our end as far as that goes?
I mean, I think there's still not a lot of clarity about who is actually going to be doing the contact tracing in the school. It's going to be the public health side or the nursing side. I don't know that that's all been worked out. Because, you know, what would happen is if I'm notified of a case and I speak to them and I know which classroom they were in and I speak with the school nurse, I don't know, let's see, it's hard to know because these are big numbers and I'm one person. So I don't know that I'm going to be able to be reaching out to all these multiple people. I don't know if maybe there would be like a form letter that might be at the school that you would then send out to the classroom to let them know. I'm not quite sure. Like, so I hear you. I think those are the things that we need to work out. And I probably need some guidance from the state to know how that is going to work. Typically, the way it works is that the person that we're interviewing would tell me who their contacts were. Right. But we're dealing with students, and you know who they were with most likely in the classroom. So yeah, it's going to be a different scenario. Deb, do you have any comment on that, about the way that's going to?
Okay, yeah, so you are right. So like we said, in the past, every contact tracing we've done has been either PM or our volunteer nurse that is also doing the contact tracing. And over in Georgetown, the school nurses had volunteered to come on board with us back in about March and April, and we trained them fully in contact tracing. So they're in a collaborative with us to work with it. And this may be something, and these are the things they haven't ironed out with the state yet, but this might be something where either they're going to have Mass Department of Public Health volunteer contact tracing to help us with this, or maybe this is where our school nurses would get involved and learn to do the MAVEN and help us do all the contact tracing with all the students. So it's something that is definitely already set out there. It's not a question I even have to ask. That went back and forth with our local public health yesterday for the North Shore, and all the directors are very anxious to find out exactly how these contact tracings are going to be done, if there's going to be that many interviews with these students, of how we're going to be able to work with the schools and have all the resources and be able to notify everybody that needs to be notified. So that question is definitely on the table. We're just waiting on answers.
I would just say,
Thank you.
Can I say one more piece to that? I think the complexity of the HIPAA question is, this is all assuming that we have to find out and we learn if a family, even if a family comes forward, if there's a student name, right, we can't start the contact tracing without revealing, right? I mean, we end up revealing who the person is who tested positive. It's clean in that elementary scenario where we know by the guidelines, if you're spending a full self-contained day the whole classroom. So we could say someone tested positive, the whole class needs to quarantine, and we just move that class remote for 2 weeks. But I think it gets a little complex, and it all comes back to that HIPAA question about, even I know even the nurses, the school nurses have more, they have more access to information, but even then they're not able to go tell the classroom teacher, oh, it's Johnny in room 12B. Not that we number rooms 12B, but they can't do that. So then how do they then facilitate contact tracing within the building, working with the public health agents and nurses, and not reveal the individual? So I think that HIPAA compliance question is
the number one question.
Absolutely, that's the huge looming question to answer.
And it's all over, and it's going to be a difficult thing where I don't know how it's going to work without having to be able to tell somebody about it,
Yeah. And Narissa, I know Nadine Marcheterre, she's one of our nurses, the nurses at the high school. Is she allowed to comment?
Yeah, sure. I mean, I think this is an appropriate time.
Is that okay? I was gonna say, because she was just, I think, has some information about that.
I believe that with HIPAA, I believe my colleague Claudia went to a specific class about COVID testing, HIPAA, and we can talk to other colleagues, other professional colleagues about who's positive in contact tracing. We can't tell teachers and other students, of course, and even within the school, probably we can't divulge who's positive. However, I can call and speak to Deb and say, okay, Johnny Smith is testing positive. We can call the pediatrician's office and they can tell us information. So that information we can exchange. So that's something that we can talk about. So that would help us with contact tracing. So I can call and talk to Deb and we can exchange information. And I can call the pediatrician's office without the parents' consent and talk to the pediatrician and get, did Johnny Smith test positive? And that's information we can get.
So then how would you, Claudia, again, because it's going to be a piece of cake at the high school, so how would you then go about the process of contact tracing? So say we've got 4 blocks and you know the name of the student. Do you literally have to interview in a way where you're not revealing the name of the student?
Yeah, we can't say. We can say you've been exposed. Your student was in a class with a student that tested positive. You were within 6 feet of a student that tested positive, and you need to quarantine for 14 days, or you need to get tested within 4 to 5 days of your last exposure, which would be on X date, and follow up with your physician. And if that person tests positive, then it goes on and on.
And so then it's based purely on what that student reports where she or he was, and where
they're going to sit in a specific spot in their classroom.
Right. So I'm saying, so it's either our knowledge of where they went or them self-reporting, which goes back to how prescriptive we need to be in regards to where students are at all times in the building all day, every day.
So we'll be able to talk to the teacher and say, where do your kids sit in the classroom? And we'll know by attendance that, and then I'll be able to talk to the teacher, who sits where in your classroom? And then we'll be able to tell who was exposed by seating charts.
Okay.
So I do think you're right that the seating charts are very helpful. I'm wondering, I don't know, I was just thinking about this yesterday. When, let's say, a student comes into the health office to the nurse, and they're exhibiting signs of COVID, so you're going to, put them in the isolation room until they get brought home. Would that be a time right then where before we even know, but we know that they're having some symptoms, where maybe there could be some documentation right then of who they were with that day and a couple days before, as long as you're going, I think, 48 hours before started having symptoms is how we usually look at it. So I don't know if there'd be some kind of almost like a quick contact tracing right then at that moment as they're sick and they're leaving the school that maybe we could refer back to if in fact they do test positive. I don't
That might be difficult. At any one time we could have 5 or 6 kids waiting to be seeing us. But you know, as we follow up with the parents at home. But it is very, you know, definitely worth considering, you know, checking in with them. Something to consider is they're going to be swapping classes 4 times a day, possible after school activities, cafeteria. Hopefully they'll be able to stay in the same cohort for lunchtime. So that it is a large group of kids that they could potentially be exposing.
Okay.
But definitely worth considering, especially if there's not a line of kids waiting to be seen.
Thanks, Claudia.
I think hopefully they can, I was gonna say, maybe there can be a whole conversation there separately on that, because I think that's, I hope that's worth exploring. Erin?
Actually, I had a couple more if I
sorry.
could.
Oh, sorry, Paul. Didn't mean to cut you off. Go for it.
No. And I half expect to get laughed at asking this one, but is there any ballpark as far as a realistic turnaround time for testing right now?
Yeah, I'm sorry. I wish I could tell you it was better and now it's worse. So I don't really know. I did have someone recently, not in Newberry, in a different, you know, I do 3 towns, but who got their result back like the same day, you know. So, and that was recent. So
The state's quoting 10 days right now.
So, but if I could add to that, this morning's, when I was at the Georgetown meeting this morning, they had a nurse practitioner that's at Children's Healthcare, and she stated this morning they just got the rapid test machine. It's extremely expensive, but for her patients, she said that they can get the turnaround within the 24 hours after the testing. And so they actually already purchased the machine, and I think we're gonna see a lot more physicians and maybe pediatricians that actually purchase the machine itself, and that might help. So there's one already, and I believe they are a large pediatrician area around there, but they have this rapid machine that can test that quickly. So that was kind of good news that, you know, maybe some other physicians will follow suit.
And is the rapid test as reliable? Is it, I had heard at some point more false negatives or even false positives. Is that still the case with the rapid test? Or maybe that never was the case and I just totally made that up.
no, I think my understanding is that you are correct on that, and I think it's more that it can sometimes be falsely negative.
Okay.
Okay.
Gotcha.
So sometimes they might want to say, okay, so if that comes back negative, you might want to do a PCR test, you know, which is the molecular test, just to be sure that you're not missing anything. But
I guess one more, can I ask one more follow-up? I think, like, you know, me and growing up and my kids, it's been strep throat, right? And it's the same thing. It's standard. You go in, you take the rapid strep test, and it comes back in like 30 seconds, and they say negative, but they say we're gonna submit it for the regular full test anyway. Is that standard, right? So you test negative on the rapid test. Do they automatically say, but we're gonna, I forget what you called it, the PCR?
PCR, yeah, like the PCR, which is a molecular test, which is kind of more the gold standard, you know, the one that they really are having. I don't know. I would say that I know that the guidance says that was what they recommend to the physicians to do, but I don't know in practice.
It's not. Okay. That's fair.
So my last question may be too theoretical, and if it is, just let me know. But if a town decides to go remote, says there's too much risk, we want to go full remote to mitigate that. Obviously, there will be some kids who will be in some type of daycare situation. Is there any possibility that we accidentally create a situation where now there is spread elsewhere? And again, this, I don't know as far as purview of the committee, but there's spread elsewhere, but now we don't have the school's contact information to fall back on. Is there a possibility that we shoot ourselves in the foot in that way, I guess, is what I'm trying to ask from a public health standpoint?
Can you speak to, I'm not sure if I understand.
I don't understand that question.
So, so this was posed to me by a parent who was asking me the other day. So, theoretically, we go remote, right? We decide there's too much risk within the building. We go full remote. And family X, Y, and Z send their kids to daycare where there is then some type of outbreak. Now we've got an outbreak despite going remote, but we don't have the school's ability to contact trace in the same way. Is that potentially more of a problem? Is that really just too far theoretical to worry about? Like, we've got to just make the choices here?
Well,
Brian,
that's.
if I'm getting too crazy, please let me know.
No. So it is a good question. So I would assume that it would take it out of the DESE thing, and it would bring it back to public health, and we would treat it easily because we don't have the conflicting, Mass DPH versus DESE. So it would fall back. Pam would do it just like she would right now if there's a case at a program or a school. So it's actually done without getting the conflicts of the two state, guidelines. So she would contact Trace exactly like she would, as the kids are home at the summertime or in a summer program right now.
Thank you.
Yep.
Is that it, Paul?
That's all.
Okay, just checking. Listen, I know Paul Goldner's had a chance, so let's just come to Caitlin and then I'll go to Paul Goldner.
I think this was brought up a couple meetings ago, but I want to flip Paul Myatt's question. If we go hybrid, then there are children that will need to be in daycare or other centers on their days that they're not in school, and therefore exposed in a different way. And then do we end up in the HIPAA gray land again, where they were exposed on a remote day elsewhere, but we have lag time finding out about that, and then they show up the next day and then every other day until that is that like a high possibility of an issue?
So I would again think that it's no difference of if the child is home for a weekend and we don't know exactly what that child is doing, if it's could be at a playground with more children too. I mean, so again, that contact tracing is once they're exposed and we actually have confirmation of it, the contact tracing is going to have to, regardless of if they in that period were at a park or at a friend's or at daycare. So it's really going to be the same. We actually had a somewhat of a conversation on they talked a lot this morning about the hybrid, and the pediatrician, nurse practitioner was saying that, they were going back and forth of doing Tuesday, Thursdays school, and then other children doing Wednesdays, Fridays. And then they were looking at, the exposure of them doing is better 2 days on, 2 days off, because it shows symptoms on the 2 days, So it was back and forth on. It's very difficult, and I understand this is a very hard time for all of you to come up with a plan that's, because it's difficult for everybody to determine what is right and what is wrong. I mean, I don't know if any of us have the exact answers, but there were lots of talks on that too. And it was talked about, are they being more exposed out of the classroom? And like you said, in a daycare, or it's a very challenging situation.
Can I ask what the outcome of that conversation was?
Maybe there wasn't one.
There wasn't one?
That's exactly what we were just saying. That is that, they can be exposed anywhere, unfortunately.
Is that it, Caitlin? Are you?
I'm good, thank you.
All right, thank you. Back to Paul Goldner.
I think Erin had her hand up and then accidentally put it down. So
why
don't you take her first and come back?
All right, thank you for ceding your spot in line.
Thanks, Paul. I do have right now 2 questions. So the first one is, do Nadine and Claudia have access to the class list without having to go to somebody else to start doing the contact tracing to understand who was in the classes?
Yeah.
Okay, I didn't know what kind of access they have into the system with the schedules for the kids to track them down, that sort of thing.
Yeah, as a general rule, with Aspen, we've got all the schedules and everything. I'm guessing as we develop seating charts, right? This is not going to be the typical return. So we'll have to talk about exactly what, you know, as far as seating charts and all that. But it, and maybe there is a way to do that in Aspen, but you know, certainly scheduling, yes, I believe, you know, nurses at all the schools could easily look in and know where to find students. They're very skilled at tracking them down.
Then my other question goes to Pam and Deb. If we send you over a name of a student that's sent home that has, you know, visible symptoms of being sick in a suspected case, do you have any responsibilities to do anything further if the family doesn't choose to go get a COVID test?
Well, I guess,
So can I just say what the DESE guidance says is families don't have to, but if they choose not to test, they have to quarantine for 14. Quarantine, like a rhyme. But I think that, you know, and then I think that's to your question, Erin, is there any way, and then if they do test and test positive, it's the 10 days because they've already served, you know, 4 days of their sentence and all that. But I think just to make sure you understand the DESE recommendations, it would be lovely if that actually aligned with what you were about to say. But
so on top of that, that would make sense because it's the exact same thing as the public as an employee or human resource. So if an employer says to an employee, you know, you have to be tested and they refuse, the employer could turn around and say, well, you're not coming back until 14 days quarantine. So that's, so it would be the same as, I assume, is subject to the schools where anybody that has the symptoms that may refuse, that it should fall under the DESE to say that, you know, that they can't return for 14 days. Just like the new, I don't know if you're all familiar, but the new traveling guidelines that will be in effect as of August 1st. And so you got to remember that whether it be teachers or students that may decide to go, you know, out of the specific, I think it's New England, New York, or Hawaii, if they go anywhere else, you know, whether it be Thanksgiving break and go for, you know, whatever, Thursday to Sunday, they have to they're mandatory to either quarantine 14 days or within 72 hours have a test done. So that's a whole nother wrench that, you know, you'll want to make sure that's in your policy so that whether a student or a faculty person goes out of the state into those places, that will be in effect as of August 1st.
So, but just to confirm, they have to tell us they're traveling for us to know, right?
Yes, yes, that is true.
Just making sure that's clear, that there are a lot of families, students, families who will choose to travel and
not tell.
You know, and not tell us. I mean, it's not a shocking news to that there are very polarizing opinions on this virus, and the severity of it, how we should be responding to it. So there are families who are choosing to not believe that this response is appropriate, and they're entitled to their opinion. But that leaves those decisions. We don't have any way to track that. So I was having a debate with someone today in regards to, that's a great policy, and I wish we could charge the $500 and use it locally. But it's just a matter of that's requiring someone to self-report. And I would like to err on the side of, you know, assuming positive intent. And so we'll do that for now.
Yeah, that's true.
My question was stemming from the complications of if the person doesn't get the test and then the inability to share that, whether or not there was additional things or steps taken to figure out whether or not we needed to contact anybody else in the classroom to be careful. If you understand where I'm coming from.
Yeah, I do understand what you're saying. I think without a confirmed, you know, I think you could be on alert, but I say that be out of school quarantine for 14 days, assuming someone had COVID, you know, personally. Yeah. Mm-hmm.
You good, Erin?
Yeah, thanks.
Okay, thank you. Paul Goldner, the most courteous member we have.
Once.
Just once, all right.
My question is hopefully pretty easy. If you have a positive test, how many days backward do you do the contact tracing from the time of the test? And is that different if the person is symptomatic or asymptomatic?
So, yes. So how that would work is if someone is positive, you are going to go by the date that they started their symptoms and go back 48 hours from that. So if they started their symptoms on, a Saturday, you're going to go back 2 days to Thursday, 48 hours before, and see who they were with during that time. If someone doesn't have any symptoms and they just took the test, then you're going to go from the date of their test and push back the 48 hours as well in terms of trying to find their close contacts. Is that clear?
Thank you.
Okay, you're welcome.
Other questions from the committee? All right, I have a couple myself. So can you talk a little about kind of testing access? And I don't know if this is a Pam or a Deb conversation, but I'm just curious about how many places there are to get tested in the area, particularly if somebody doesn't have a primary care or a pediatrician, and how the access is to those spots. Because, I mean, I'm wondering if we're, I don't know, are we sending somebody to Salem, Mass for a test, right? If they don't have a primary care in the area, are there places that are closer? If they're going somewhere and they don't have a primary care, is it someplace where they have to go and wait 4 hours in a line to get a test? Can you just give us an idea of what testing, I guess, what the snapshot looks like in this area?
Yeah, do you want to speak to that, or?
I can start it. So there are several on the website. And I can send the link out of where the different testings are. I do believe that, and correct me if I'm wrong, Pam, that they need either the primary care physician would have to order it, I believe, to have the test. But according to this morning to the nurse practitioner, she said that there's a home test out there, and the results are within 3 to 5 days. And they get it through LabCorp, C-O-R-P-S, LabCorp. And she said it's $119. And she said that they have found that the studies have shown that those are very accurate too. So that's something I just learned as of this morning. But there is a link to showing where you can actually go get these tests done. But I thought, and again, this is more of a medical PM question, but I thought you had to have a referral or a primary care physician or something. I didn't know you could just go get that test. Is that correct?
I think that that's accurate, but of course, like you're saying, not everyone has a primary care physician. So if I could, I'd like to look into that and get that answer for you, because I'm not 100% sure on what someone would do. And I know there is a map, and we've used that, and I send it to people a lot. It will tell you what the closest places are, and they always tell you to call ahead of time to make an appointment so that you're not in that scenario, like you're saying, waiting in line.
I think on that map, I don't know, I think it's the site that you're referencing. It's a kind of map of the state, and you can sort by your area. You can actually sort by no referral required. And it obviously, the list of available options, I want to say Lawrence General is one of them. So there are some sites, but primarily you need a referral. I know this, having a daughter starting college, right? And all of a sudden they say you need a negative test within 3 days of showing up, and trying to arrange that, and being ready with that piece of paper in hand for arrival is quite a feat to try and organize.
And do you have any idea on, I guess part of the question that I'm going to here is the question of equity, right? We have students where families do not have cars. We have students where families don't have internet access. We have families where there's obviously a wide variety of healthcare available to that, coverages that they have. So I'm just trying to get an idea of, are we in a situation where a family with means could go and get a test very quickly and 3 days later have a result and be back in a classroom. And we have another family that either can't afford it or doesn't have kind of the healthcare setup that another family might have, or doesn't have access to a car. And what, I guess that goes to my questions. Where are the different opportunity levels here? Are there students that we're severely limiting in saying you need to have a negative test to come back to the classroom, as opposed to waiting the 14 days, where they literally either cannot afford it or don't have the opportunity, or whatever that comes down to?
At first blush, I'm going to say, I think that what you're saying.
You know, you
Okay.
can
I
go.
was gonna say,
You can go to Convenient MD right in Story Ave in Newburyport and walk in and get a test if you're symptomatic. I know they take Mass Health there. You would have to have a car to go there. I know Anna Jakes Hospital is a testing spot. You can't go to one of their extensions, but you can go to the hospital and get a COVID test. But you would need a referral, you'd need a lab slip from a doctor. And that you would have to have a doctor for that. But there are equity issues in that. But yes, you can walk in and go right to Newburyport and get a test.
Claudia, did you want to add to that? I saw your hand up.
Thank you, Narissa.
Thanks.
Thank you, Pam and Deb, for coming out tonight. I do know you can go to CVS in Danvers. That Minute Clinic also tests, and you don't need a referral to go to a Minute Clinic. I don't believe the Minute Clinic in Amesbury is testing at the moment. But I agree that the transportation is an issue. Convenient MD does accept Mass Health as well as Anna Jakes. And then if we know of a family that's having trouble connecting to the Mass Health system, there is a point of contact at Anna Jakes that we as nurses refer families to as well.
Okay, thank you. And if they don't have a referral, is there a charge on it versus having a referral? Do you know, like an out-of-pocket cost? I'm not going to hold you to it. I'm just curious.
This would just be my best guess with Mass Health and COVID testing. I do not believe there's a charge for that, but that's just my nurse hat on right now, making a best educated guess. But I'm glad to look into that for more information for you.
Yeah, I mean, I think that's important. I would hate to
It's
see,
a good question.
Yeah, families be stuck in a bind and having, obviously some different treatment just based on personal circumstances.
And it also has to do with, I think you mentioned it, Nadine. I think it was the one in Newburyport on Story Ave. If you're symptomatic, you can get a test, right? So if someone was exposed but asymptomatic or needing a test to return for employment, it literally changes. And again, you could say my stomach hurts, I can't smell anything. And I mean, then we have a health system based on lies, but.
I think if you were exposed, they would probably test.
They would do it?
you.
Okay, that's good to know.
Yeah.
Narissa, I know the CVS in Salisbury does too. You just need an appointment.
Okay. Thank you. Claudia, did you have something to add? Or your hand was still up?
I do. I guess I'm looking for some clarity, and maybe Pam or Deb could help. Scenario. Let's say there's a scenario. I have a student that comes in. They're symptomatic. I have my list of symptoms I'm screening for. I need to dismiss them. I think for school nurses, of course, we'll call the parent, and then it would be. School nurses make an assessment of the situation. We don't diagnose COVID. So it would be that I would refer that student to the healthcare provider or a testing site to be tested. And then I guess I am questioning then the chain of communication. I contact the local board of health in the town, or does the healthcare provider contact the local board of health in the town? I guess I'm looking for some clarity as the school nurse and chain of reporting and command, while respecting HIPAA. I know I can call, say I send student Jane Doe to the healthcare provider, I suggest to the parent they have symptoms, they should be tested, I can call that healthcare provider the next day and say, did that parent follow up and have the student tested? They were presenting with COVID symptoms at school. I don't need permission to do that. But I guess I'm wondering, at what point does the school nurse call the local health department, or does the healthcare provider call them first? I guess that's a little gray for me, and I think some clarity in that chain of command or chain of communication would be very helpful. I don't know if anybody else, I don't know if anyone has any comments on that.
I have the same question, so I'm
Oh,
glad.
good.
I'm glad. Really, as the public health nurse, the only way I'm going to know is
yes,
the test comes back. So I'm
right.
not going to be notified by the physician or by, right? So I'm only going to know then. So I don't know if it makes sense if we had some kind of, you know, communication where at least I had a running log of who was sent home, so that when that thing pops up for a test, I know you already know about it, you know, and we can, if that makes sense.
It does. So I did work in the field years ago during the H1N1 flu outbreak, and I'm just thinking back to that time. And, you know, before I left for the day, one of my responsibilities that came from the public health nurse in Peabody was that I had to fax her or communicate with her at the end of my shift in the school, how many people did I send home with H1N1 symptoms? How many positive cases did I know about in my school? So there was an ongoing communication that was transparent and clear between the school nurse and the public health nurse. And I guess, I mean, I know all of us nurses and with the community at large, we're looking to do right by our staff, students, families, and be as safe as possible. So I guess, and then I'm wondering, what is our district policy going to be? Are we going to need medical clearance from a healthcare provider for the student to come back to school? Or is it going to be the contact tracing when we know that student one was tested and they can come back at that 10-day mark and they've been symptom free? Or is it that student didn't get tested, they're coming back at that 14-day mark and we know they're in the clear, or staff member? So I'm just looking for some clarity.
Yeah, no, I understand that. I mean, I'm not sure about the schools, the way it works out in the public, like you're saying.
Yeah.
If I was to put a student on isolation and say, you know, you're positive, you've got 10 days at home right now, give them the dates, you know, they know what they are, and I follow up with them during that time period. Typically, they need clearance from public in order to return. So I'm assuming it's going to remain that way. But I'm not sure. You're right. So
I guess I'm wondering, will that then be our district policy that the student needs clearance from the healthcare provider to return to school if they have been COVID positive or suspect, sent home because of suspect COVID symptoms? Do you know what I'm saying?
Yeah, I do. I mean, I think if they're a confirmed case, usually it needs to be by public health that they get clearance, not by their primary care. But I hear what you're saying for if it's a suspect, you know, if they're not a confirmed case, then that's different. Perhaps we need to, as nurses, might need to just talk amongst ourselves a little bit to come up with some of those protocols.
Yeah, I think that would be a great idea. And that actually kind of goes to one of my questions too, if I could jump in here, which is one of the things that it says is that if you have a positive test, that you do need to be cleared through the contact tracer to return to school. I am assuming that's you, Pam. What exactly would they, if assuming that it was Newbury, what do they need? What do they need to satisfy to get your okay to say, yep, they're good to go?
Okay, right. So it would really just be meeting those requirements. So if they were confirmed, they've had 10 days at home, isolated, we know what the dates are. We base it based on either when their symptoms started or when they had their test. And they need to have, well, our new guidelines now are the last 24 hours need to be without symptoms and fever-free, but I do notice that the DESE guide protocol still says 3 days. So I don't know if that's going to change. That just changed for us within this past week. So anyway, if they meet those guidelines, then I would just say to them, you're all set to go. I guess it would depend if the school needed to have some kind of form letter sent to you saying that such and such has met their requirements. I mean, we do have that. That could be part of it if you needed that. I don't know. Usually it's just it's a conversation. So usually I'll just say you've met it and you're ready, and then that's kind of documented in Maven, and then they're set to go. But it's, yeah, if that makes sense, and sort of same for the quarantine as well.
However, PM, do we have, remember we had a template because a couple of like first responders or something needed a letter saying that they could return to work? I wonder if that's something either DC or Mass DPH is going to come out with, is maybe a letter just like the template we used where we just send them something saying that they're cleared. Remember when it first, back in March when we were doing that?
Yeah, that's what I mean. You know, that those letters go out just saying that such and such met the requirements for isolation and are free to return. But I don't know if the school, you know, would require that or not.
Right.
It does take a little bit of extra work to maintain that for that number of people, but it is possible.
I would just throw out circling back to the HIPAA compliance thing. I want, again, you know, Claudia and Nadine, and I know Tara's on the call too, you know, as far as nurses, what we keep on file, making sure that's protected. I would prefer not having extra pieces of paper that can float around that would then identify that a student was even the one who tested positive. So I think, you know, however the clearance goes, if there's a good line of communication between nurses, public health nurses, and again, Newbury, Rowley, and Salisbury, I think that's the most important piece, is the protocol. And then when, you know, in Newbury, Pam, you give the okay, and if it's Claudia at the middle school, great. We say that family is ready to return. Obviously, if a student was gone for 14 days, you know, if the whole class was quarantined, no one would ever know who it was. Obviously, it was one individual. It may be a little more obvious, but I just think protecting that HIPAA compliance is
it makes her work a lot easier.
Say that again.
It makes it a lot easier too. We've got a lot of paperwork as it is, so that's
yeah. I was going to say, you know, as we jump into this is going to be about effective processes, not another piece of paper, right? So we want to make sure we have good plans in place to do the job well, not necessarily, you know, add another piece of paper to your requirement.
Yeah. Pam, I think this is a question for you. What happens if you have someone who is clearly showing symptoms, but their test comes back negative?
Well, then they would stay home and isolate, but there wouldn't be what do I say? You can't assume that, you know, you can't like force them to isolate for 10 days. So what I would say is that they need to, you know, stay home and isolate until their symptoms are completely resolved and they haven't had a fever and their symptoms are gone for at least 24 hours at that point.
Okay. Thank you.
Unless they were here's a scenario. If you're telling me that they were a quarantine, someone that was a close contact to someone that was confirmed, and they were being quarantined, and then in the process of that 14-day period, they developed symptoms and didn't get tested, we would assume that they were clinically positive, meaning they probably have the illness, but they don't have a test. And at that point, we would have them isolate for 10 days. So do you see what I mean? So sort of depends. Are we
it's situational.
Those they were in contact with someone who was positive, or is it just someone who's saying, hey, I wasn't feeling well and I'm refusing a test? There's a difference.
Okay. All right. Thank you. I think this is a Deb question. One piece of DESE guidance says, and I'm not going to ask you to comment on this, I'll say that up front, says that for gym classes that they can be held with 10 feet between students, no masks outside, 6 feet between students with masks outside, or 6 feet between students with masks inside. My question for you is, inside strikes me as very similar to like a private gym. What are the requirements in the situation of a private gym for social distancing and masks? You're still muted.
Okay.
There we go.
So I'm trying to understand your question. Your question is the 6 feet
Yeah, so
outside.
I guess what I'm trying to get at is I'm wondering if DESE's guidance, because it strikes me as, I don't know how to put this nicely. It strikes me as not being logical that 6 feet outside with masks and 6 feet inside with masks, knowing that you're lacking that ventilation, are equally okay. So my question for you is, if this was a private gym situation, what are the requirements on a private gym? So you have somebody that's reopening their gym in town, right? What are you going to tell them that the requirements are? I don't know how you do it, between pieces of equipment, or I don't know what do you tell them?
Okay, so a couple of good questions. One is, so our guidelines, and I don't know if you've all followed it, but our guidelines are hundreds of pages of everything between, you know, camps and everything. We don't have any any public gyms in our town, so I'm not that familiar with the guidelines. However, and I'd have to double check them and look them up and see if they match the DCs or not. I think it's just the machines have to be specifically apart, but if they're, you know, as far as the mask, I would have to look that part up. But I do know, I will say, and no offense towards DESE, this is the first, you know, DESE is really a new word for me. I just learned it since it's COVID. They're more, you know, it's educational and it's not public health. So that's why we're conflicting with many things. And I agree that does not make sense why same scenarios, 6 feet apart in both situations, but one mask. But it's the same thing as where the DC says students can be 3 feet apart, where everything in our regulations and guidelines say 6 feet apart. Mm-hmm. So it's that same scenario that if you're within 6 feet of a person more than 10 to 15 minutes, then you could have potential exposure if the person is positive. But then that's our guideline. But then DC says students can be up to 3 feet apart. So does that mean every student that's within the 3 feet can, you know, they're there more than 10, 15 minutes. Now you've got to isolate that entire area. So, or quarantine that entire area if there's a positive. So I cannot explain why these, you know what I mean? If that makes sense. So
that might be my favorite line of the night.
that summarizes it. Drop the mic and go down.
It is hard. And same with, I mean, Pam and I throughout this, and I really appreciate you all understanding that, you know, we don't have, I mean, I've got 2 pages now of questions. So I wish we had 100% of the answers. And because even though we can tell you pretty black and white on the public part of it, if we get a positive case, Pam knows how to handle it immediately. Different scenarios, she'd call the person up, she'd tell them whether they have to isolate or not, and it's really strict, and she'd make sure they're following through. Where the schools are so, it's a totally different situation, and where everybody isn't on that same page, and DC has such different guidelines and ideas, it becomes difficult. And that's why, again, unfortunately, we can't answer all the questions, but I have no clue what that scenario for the gym is, because it does not make sense to me either, but neither does the 3 foot distance. So.
Yeah. So I guess one of the things I'm getting at is that obviously, like with the 3-foot distance, we've chosen to be more cautious with 6 feet. It's in line with the CDC. Obviously, at the time we were deciding, I think the very day was the day that the World Health Organization said that they were now going to consider that the virus could be airborne, and that, you know, their guidance would potentially be changing from, I believe they were set at 1 meter at a time at the time. You know, so obviously we can be more cautious. I would prefer to know what kind of the organizations aside from DESE are saying, so that we know, you know, outside of their world, what is the standard, what is set for, you know, kind of the general public, not just for their particular guidance that they've opted to come out with.
So
I guess
so
that's where I'm going.
Okay, yeah. So hats off to all of you to doing the 6 feet, because again, you get to the 3 feet, now you've got to quarantine anybody that's been within the 6 feet, and we give you all the credit. So today, this morning's meeting with the physician on, saying that even 6 feet without face covering, she said the droplets with a sneeze or cough can absolutely go further. So she's strongly recommending this pediatrician to, you know, have everybody wear the face covering. She says that people should be doing 2-ply to 3-ply. Don't, you know, that the 1-ply doesn't even, you know, cover it, and that highly recommends that everybody wears the face masks and coverings, and keep the 6-foot distance. So for your school to go on and above and say, well, we can minimize at the 3, but we're going with the 6, which is, you know, CDC's recommendations, Mass DPH's recommendations, and the science through it. So, you know, I mean, hats off to that. So, but I can try to find out a little more of why DC's deciding on the gym. I mean, I don't know why they even do the 3 feet. So again, it's something that I may not ever find an answer of where they come up with their ideas.
That's fine. I was just more curious about the general public guidelines. So if there was a gym in Newbury and they called you and said, what precautions do we have to have in place? What are you advising for us to move our, you know, pieces of equipment apart? If, you know, if we have treadmills, 6 treadmills in there, how far apart do the treadmills have to be? I'm assuming there's guidance on that, and I was hoping that you can get us a copy of that guidance.
I absolutely will. I'll forward that. I made myself a note. I'll forward that to Brian right away. And it is a full gym guideline, and that's great. Again, if you're going to follow, which is more stringent, which is recommended to the science of following our gym guidelines versus the school's guidelines.
Okay. Yeah, yeah, I don't know what will go in that direction. I don't know what they say. Obviously, we don't have a lot of giant pieces of equipment in our gym. So we'll have to figure out, I think, how that fits in, but I'm very curious as to how they compare, I guess.
I will definitely give you that, sure.
Thank you. Thank you.
Can I just ask a scenario question, kind of going to that DESE versus the real world discussion? So if we were to have a preschool class with 12 students and we have them outside and we have a hula hoop sitting on the ground 8 feet apart, and we have that class with the teacher and supports, everyone 6 feet away, including teachers, that's safe for them to be masks off if they're outside, and at that point they're 6+ feet away, correct? So in the medical world, that would be a model that would be acceptable. Again, shouldn't sit there for 7 hours in that position, not that 3- and 4-year-olds would sit there that long, even 2 minutes. But in that model, that falls within the guidelines, correct?
I believe that is correct, yes.
Thanks. Appreciate that.
Yeah.
Just trying to unpack that DESE versus real world continued saga.
Yeah. All right. And I have one more question, which is, I think, a Deb question as well. Can you talk a little bit about your experience with mask wearing? I think, you know, there's a fair amount of concern among parents that we may have students that, regardless of our mask requirements, come in and refuse to wear them. Obviously, not going to ask you to comment on that, but can you just give us an idea what happens in a public place? So there's, you know, a mask requirement, people aren't able to distance, right? And they should be wearing masks. What happens if someone, what are the what are the steps that you would advise, say, a business owner, or if they were coming into your town hall, that you would advise, say, the town clerk? What steps are there that you would advise them to take if someone came in and was refusing to wear a mask? And I should say too, we're consulting our legal counsel on this as well, and the state too.
Okay. So yeah, so basically not in the schools, but in a setting, say for instance, a food establishment that we may have, if we got a complaint that people don't wear masks or the employees aren't wearing masks, then and this has happened several times, then we would call the person in charge at the establishment and ask and reinforce that they're wearing them. Now, everyone that we have talked with honestly has complied. We haven't had any trouble or any problems. The only thing we've had is, and then that's employees and employers, because employers, once they realize that their customers are complaining, they don't want bad business, so they'll say, okay, we'll make sure we follow the guidelines and do it. But as far as customers, now we have had some situations where people get aggressive, patrons get aggressive with other customers not wearing them. And unfortunately, as soon as they say they have a medical condition, they are exempt, and we cannot ask what their medical condition is, nor have proof of it. So therefore, immediately, there's nothing we can do. And so that's a situation that it becomes very unenforceable. If somebody says they just don't want to wear one because it's their right and things like that, then we could fine them. But again, we haven't had that situation. Most of them are either just going to put it on or tell us that they have a medical condition, unfortunately. Now, as I heard this morning, though, that Desi's thing was going to say, did the student have to have a doctor's note if they weren't going to wear a mask?
It didn't, there isn't complete clarity yet. I think there is discussion about making a list, as if, making the list solves all the problems, but making a list of what would qualify. So certainly we know there's students who have a documented medical condition. They have an IEP, a 504. So we know that. But I think it's the gray area, like you're saying, where can we require, I think that's been a question asked. I haven't personally heard an answer yet, but that's a question asked of how is there an enforcement there to say, unlike like what you're saying, Deb, where all you have to do is say those magic words, I have a medical condition, and our enforcing ability goes away. So I haven't heard a definitive answer on that yet. But there's been talk about that, saying it'd be great if we could require a doctor's note. But I guess I'm skeptical that if in the real world outside of schools, that playing that I have a medical condition card exempts a person regardless of whether they have that condition, then I don't know that we're going to have any additional authority within a school setting.
Right.
All right, thank you. Paul Mayette, did you have I saw the hand go up and then the hand go down.
I can't decide if Brian just answered it or not. So it seemed to me,
I'm going to try again.
Based on that, there would be no way to go to a teacher and say, these are the 5 students in your classroom who are legally exempt. If a 6th student then said to the teacher, I have a medical condition, the teacher would have no grounds for requiring a mask. Is that correct?
I think the way it plays out in like how Deb explained it, yes. And that's my understanding of the limitation in a school setting as well. But that hasn't been definitively answered by Desi. The question has been asked, can we control that through local policy, right? So if the school committee sets a policy, a dress code, those things where if the clothing an individual is wearing is disrupting the educational process and is becoming a distraction to learning, then there's parameters we can put in place. But by and large, students do not leave their rights, hanging outside the front door of the school. So my fear is that there's no greater standard that we can enforce within the schools in regards to enforcing masks.
Did I answer your question, Paul? Okay. Any other questions? Oh, Paul Goldner.
So this is a follow-up there, and I think it's school committee rather than public health agent question. But as a teacher, if I've got students in my classroom half of whom are wearing masks and half of whom are not wearing masks because of a medical condition, I might feel safer going within, 3 or 4 feet of the students with masks to look at their papers that they're working on for a moment than I would for the students who are not wearing masks. And that may then lead me to treat those students in the classroom differently out of fear for my personal safety. And then because it's medical, aren't we heading into a discrimination area?
Bump that to Brian, I think.
Sure, you can have it. I mean, I think
you get the really hard questions.
I think we, answer that in reverse. Yes, anytime we're excluding an individual for a reason that we don't have authority to enforce, we are absolutely infringing on individuals' rights and excluding. Yeah, absolutely.
Right.
So I think
it looks like Claudia had something to add. Maybe.
I just had a question for Deb or Pam. Going back to the conversation about students then say being outside for PE class, and the conversation was if they're outside and they're 6 feet apart, they don't need a mask on. I guess I would like to know, what is the impact on a windy day? So if we have a student that is students are out there without masks, they're 6 feet apart, but a student is symptomatic and coughing, and it's a very windy day because we are in that area near the marsh, does that then carry the droplets further? I guess I'm wondering, is that risky? And
So I can kind of answer that, because this is one of them that I literally have been banging my head on, exactly what you said. And that is, once again, the guidelines, which every one of us public health directors are like pulling our hair out over it. Because now, depending which guideline you look at, so for instance, if we looked at the entertainment guideline that's in place right now, where you have outdoor entertainment, if the entertainment includes singers, brass instruments that you're blowing out of or anything, the first row of audience has to be 25 feet away. So if they have to be 25 feet away because they're singing, and yet we can play on a playground 6 feet apart. So again, these are, I don't understand where they came up. We don't make the guidelines. So I totally understand these questions are so logical and common sense, but I don't understand it either. And same with, if you go to the beach guidelines, we can all go to the beach, but you can't have more than 10 to a gathering. And then the towels have to be, 12 feet apart. And then you have, so this, so why would your towels have to be 12 feet apart from this person? But again, you go to the playground and be 6 feet apart. So I don't understand where all the different guidelines and numbers came from, because it doesn't make sense to me, to be honest. But.
Thank you. I guess that is a hard piece of clarity for me to wrap myself around as being a school nurse, because you have playgrounds, you have PE going to be outside, mask breaks outside. So I thank you.
You're welcome. Sorry.
Maureen, did you have I saw your hand go up and then go down.
I guess my question's for Brian, and it goes back to what we were discussing before Claudia's question, just about requiring the mask use. So we can't write a policy that says masks are required by all individuals inside the buildings. And if you have a medical reason, you can't request the doctor's note or some sort of documentation to say that we can't do that.
You can write a policy for whatever you want, right? So, and then the question becomes enforceability. So that's the outstanding question that every school district is asking. And rather than every district paying their own attorney to come up with a different opinion, we're asking the state to give us guidance, right? I know MASC, the question has gone up all the way. My understanding is that not necessarily, right? I haven't heard a definitive no that the policy would not be enforceable, but I've heard a resounding that is not a definitive yes. So I guess that's how I would leave it, as that's the hope, is that we would be able to write a policy, and that based on the overall health and well-being of those around, the students who are there, that we'd be able to enforce that. There is in some enforceability, but again, it comes down to the, as Deb mentioned, that magic question of, if someone says, I have a medical condition, do we have a right to have a doctor's note? There's just no definitive answer to that yet.
Would it be worthwhile to begin that process of writing a policy? I mean, as we all know, it takes some time to get policies approved through the school committee. So, I mean, time's sort of ticking away, and if the students are coming back mid-September, it would be, I don't know, I just feel like maybe it's something we should at least get started on, and hopefully we'll get the legal advice.
Yeah. My hope would be that MASC, because they draft model policies, is that I don't want to put all our stock in that assumption, but that they would draft, that they host our policy manual and advise us on policies, that there would be a draft policy. And I don't think this will take long for you to implement. I think everyone will be in relative agreement around the table in regards to the policy. But yeah, absolutely, we can look into starting a draft of that. Absolutely.
So, and just as an update, I did contact our MASC field rep. So I've, poor woman, I've been contacting her a lot lately. But part of another question I asked today, I just said, hey, are there any updates on when, pandemic related policies are coming out? And she said, well, there's a list of the ones that you're going to need to examine, but we don't have sample language yet. And I said, is there an update on, a policy to do with masks and, what might be included there? And she said, which part of a policy to do with masks? So I'm assuming that this isn't the only question around masks, that there must be others. So I need to get back to her and just say, this is the thing we're talking about. And hopefully then she'll be able to give me a better idea. So, but yeah, I think they're working, probably also looking for legal backbone, just like we would. So, Deb?
Yeah, I was just going to add a little bit to that. So this morning, I do believe, Brian, and I'm not sure if you want me to reach out or if you'd like to, but Carol Jacobs today, I believe it must be a policy she's putting in place, because she discussed at great length that she is going to require doctor's notes for the masks. So, and maybe it'll be consistent, because again, the pediatrician that was actually at the table today said, if it's her choice, she would not give any doctor's notes for even asthmatic children. She said she doesn't know of any child that can't not wear a mask due to medical. So I'm just throwing it. She was very adamant about these masks. So again, I know that a policy is getting in place there, whether she's drafted it or not. I could reach out and ask her.
Yeah, I can reach out to Carol too.
Create the wheel and ask her if she has that template, what she's doing, but because she was asking about the doctor's note with us, and I gave her the same story I told you, and that is we can't enforce that. But if you were to do a policy, and I would assume it'd be the same thing as if now that, like, I want to say maybe it's Home Depot or Walmart or Lowe's, that they're mandatory now, certain stores that require no matter what, you don't go in. It's like a no shirt, no shoes required, that you can't step foot regardless if you have one or not. And so maybe it would fall into there, and that would be your legal counsel to ask. But I can definitely shoot out an email to her and ask her if she's got that policy in draft form and shoot that to you.
Yeah, that's great. Thank you.
Terrific. Thank you, Deb. Any other questions from the committee for either Deb or Pam? All right, seeing none, thank you both for your time tonight, and to the school nurses as well for hopping on here and spending your time. I know it's 9 o'clock on a night. I'm sure you'd rather have to yourself. So we definitely prefer that, and look forward to hearing from you down the road. If there's anything, obviously there's going to be ongoing communication, but if there's anything that comes across your desk that you say, I think this would be really helpful for the district, if you can send that over, we'd appreciate it. Because we're doing as much research as we can, but if you're getting things directly that would be relevant, that would be terrific to be able to see those as well. All right. Thank you very much.
Thank you for having us.
Thanks, Deb and Pam.
Okay.
Good luck. Thanks.
Bye.
And Claudia and Nadine. Don't know where they went.
And Debbie and yeah, there's,
And
I
Debbie,
think they were
came
all
in.
on here.
Yeah.
I was gonna say, I
And
looked down the list
Tara.
at one point and said, oh, nurse. Yeah. Okay, Brian, transportation update.
Yeah, so I'll pass it over to Kyle. I'll let Kyle do some talking. I always talk a lot.
Yeah, so we have some diagrams from the bus provider. They were actually provided to us a little while back based on certain scenarios. So based on those diagrams and sitting students every other seat, like we had been chatting about, we can fit 12 students per bus. I'm trying to schedule a call with the bus company to go over some specifics. Certainly to make sure that those diagrams fall within the 6-foot guidelines. Like we've been chatting about too, it's kind of with ridership, we're going to have to find out who the cohorts are, who's going to be taking transportation and then back in. But we're going to be maintaining open communication with them. There's actually a new VP over there. So we had our initial meeting a week or two ago. Going to be following up with them. Forgive me, I'm forgetting some details. But
Yeah.
Brian.
So I think I would just say, so the question being, what would that mean, right? And where we don't have a definitive answer, and Narissa and I were talking earlier about there's again yet another example of a question where where the answer to the question lies in the needed answer for the next question. And so on paper, right? So the basic survey data says that of the people who responded, about 35% said they'd be comfortable. Rough figures, 35% said they'd be comfortable with one student per seat. About 15 if we went every other seat. Another, that's 50%. Another 50% either wouldn't feel safe either way or don't use the bus transportation. So if that is truly representative, on paper, riding buses 1 per seat per DESI guidelines, we would be able to do that assuredly, not confidently, in the hybrid model, because we would be bringing in roughly half of our students each day. We don't have many, or wouldn't have any buses riding over 50 at full capacity. So that being the case, if you just cut that in half on paper, we would need to have a quarter of the students interested in riding the bus to be able to do a single tier of bus runs every day with 1 student per seat. Obviously, if you combine those who are comfortable with the DESI guidelines, and then those who are comfortable with if we went every other seat, which is basically at the 6-foot standard, it's roughly half of the folks said they would still ride the bus. That would likely land us in needing to do 2 tiers to bring students in with 1 student every other seat. So I think it's what we basically guessed last week, and doing some quick math. Again, we don't know exactly who's going to ride the bus. And certainly we want to get to the point where we can say to parents, here's how we're going to run the buses. And I'm going to ask you to commit student name, so we can confirm, are you going to plan to ride the bus or not plan to ride the bus? And then start to arrange those numbers. But as Narissa was pointing out earlier, that obviously whether a parent feels comfortable sending their student in has a lot to do with whether they're choosing the fully remote model or not. So again, it all comes back down to that decision about what that remote model looks like. There's no further additional concrete information, but I think if you would have asked Kyle and I to guess right now, absolutely, we would likely need to do staggered start times at both levels if you were to run 1 student every other seat and only use a ridership number of 12. I'll leave it at that.
To add to that too, I found my sticky note. I have 9 in front of me. So I sat in on a conference call yesterday as well with DESE, or actually hosted by MASBO, where we're going unpacking the guidance. There's some certain details that came out which were pretty interesting. The guidance requires that hand sanitizer be at the front of each bus, which the RMV does not allow. So they have to get each company has to get specific permission to have the hand sanitizer on their bus. So it's things like that we want to make sure, as a company working with them, we know they've typically been all over this type of thing, but certainly unpacking that with them as well. So interesting, food for thought.
Sorry, I just muted. Any questions from the committee on bus guidance or the busing information, transportation information? Not anything you need action on tonight, right, Brian? For sure.
No, I would love for you to say, no, here's what we're going to do, but I know the answer is going to be, well, we're waiting on a couple other answers to give that. I would actually love to give you a list of about 72 questions and have you make all the decisions tonight, but I don't think we're there. So
all right,
nothing definitive.
Kaylee has a question. Go for it, Kaylee.
Hadn't we previously mentioned that because we're a public school, we legally can't ask them if they are or are not going to ride the bus? Has that
Correct.
changed, or?
That has not.
So how are we going to?
Yes, so what we're trying to do is marry guidance from the Department of Ed with laws and regulations that they created, because they're conflicting right now. So as of right now, no, we can't preclude someone from riding the bus. So I think, to your point, I can't say to you, Kaylee, an incoming junior, that you have to decide right now whether you're going to ride the bus at all this year. And then if you don't sign up, you don't have access to the bus. So that's what's illegal. This would have to be, again, another one of those situations where it's kind of call it like a rolling admission, right? If someone eventually says, I need the bus, we wouldn't be able to, as it stands right now, say you can't get on the bus. And obviously, if we have 12 assigned seats, we would have to find a bus route that's got an available seat, or find another way to work around at an additional vehicle. So another piece we're working with NRT is they do have extra vehicles. Our contract requires that they have spares, that they have 6, Triton spares on hand. Obviously, we've talked about this, for years now. Bus driver shortage is the norm at this point. So that's not to say we would overnight be able to find a new driver, but we would likely have some capacity, and that's another one of the things we're looking to confirm, have some capacity to add another run if we needed to, but that's adding additional cost. And it's a whole other run. So that's not, that doesn't end up to be small potatoes over the course of the year.
Okay, thank you. I just wanted to double check on that.
Yeah, great
a little
question.
bit confused.
Good memory.
Caitlin?
This may seem like a strange question, and Kaylee just made it pop into my head, but what about the surprise child bus rider that just appears and needs to be driven to or from school, or has to change routes because of childcare just randomly, or like a family emergency? Do we just leave them somewhere? Or?
So that's the question. Certainly, the guidance would say, no, this has to be entirely prescriptive, right? So you have to tell us if you're riding the bus or not. Fine. If you say you want to, we'll get you on, but you can't show up at the bus stop and say, hey, I'm hopping on the bus today. We have to have assigned seats, right? It's very prescriptive. That scenario is problematic. Once the student's to school saying, oh, my mom said I'm supposed to not get on the bus, I'm supposed to get on the bus today, that's okay. We have the child, they're safe, they're in the office, we keep them there until we make contact. But it's similar to the discussion about having drivers doing the screening, the health screening at the bus stop. If someone's standing there and, clearly symptomatic, vomiting, fever, they can't say, all right, I'm going to do a check and say you're not healthy. We've got to get the child on the bus and somehow bring them to the school and keep them safe and move them or keep them with us. So yeah, that is a potential problem. I would hope it would be not the norm, but it needs to be very prescriptive in regards to saying you can choose the bus, but you have to have an assignment, and then we would find those slots.
All set, Caitlin? Yeah. All right, thank you. Maureen, and then I'll come to you in a second, Kaylee.
So Brian, I know at the middle school and the high school level, those students are often allowed to hop on a bus, not necessarily the bus they've come in the morning, but if they're going to a job or they're, you know, I know students that take different buses home, or they're going to, you know, I don't know, various locations. I know there's a lot of kids that go to NES.
Yeah.
So, I mean, I'm assuming that won't be allowed.
Absolutely not. Yeah, there's no way. Right. So we'll be able to arrange for, if someone says, I need to have childcare on and go to grandma's house every Thursday, we can work with that, right? It may not be a perfect science, but we can work with that. But hey, I'm going to hop on this bus to head down. Yeah, there's no way. It's because it has to be literally assigned seating.
Yeah. And then, I know there's obviously no decisions yet on, you know, after school activities and sports, but this would have a huge impact, certainly on sports, because, you know, you've got a soccer team of 40 students, JV and varsity, and you can only get 12 on a bus. That's going to really impact the athletic budget if we have to get a lot more buses, if sports are running, and we don't even know that.
Yep, absolutely. Yeah. Yeah, the 6 foot distancing on the bus has a far more significant financial impact out of the gate than maintaining that 6 foot perimeter or that 6 foot distancing within the schools.
All set, Maureen? Yeah, Kaylee?
It was kind of just a piggyback off of what Caitlin had just brought up, but couldn't we do what a lot of other districts do since they have the limited busing, where you're only allowed on this one bus, and it like says it on your student ID what your bus number is, and that's your bus?
Yep.
Can we do something in that regard, or?
Absolutely. Yep. So we talked about that, what we can use IDs for. We've actually talked about IDs. I know, could we figure it out in the cafeteria, right? So make everything and have it be swiped, so everything is as contactless as possible. But absolutely, yeah. And I mean, whatever the system is, whether it's an ID or a slip of paper, that you would have a bus assignment and even a seat assignment listed on that. Absolutely.
Any other questions on transportation? Hi, Maureen. Are you waving at me?
Yes.
Other Maureen. Okay.
Yes. My child goes to a different district, but my concern with the whole bus thing is the assigned seating, and he's going to be a 6th grader, and I just find it, how are they going to stay in their seats if there's no monitor? And I feel like it's a safety thing for the bus driver to keep an eye on that. I think it's very risky.
That was going to be my question.
What's that?
I said that was going to be my question when we got to like the chair part at the end, was that DESE's guidance actually recommends monitors, and I was going to ask Kyle if NRT has talked about whether they have staff that could be bus monitors. Should we opt to go that route, and if we have an idea of what cost would be and that type of thing, because obviously that was a fairly major factor in their guidance.
I think I'm not sending my son on the bus only because of that, unless there is a monitor on the bus, because I think it's a huge safety issue. Huge in regards to kids getting in trouble, the bus driver watching them. I think it's definitely something that needs to be looked at.
Right, and we'll absolutely have that conversation. I apologize, we haven't. I've certainly been trying to get a hold of them. But it is interesting to just, I'm looking at the guidance where they get, not to, but you know what I'm saying.
I know. Guidance and reality, right? Don't always mix.
So where they're asking for suggesting volunteers. Also, they suggest student representatives, which is actually illegal from what was discussed in the conference call I had the other day. So it's challenging for sure, but very eager to see what they have for options that they've been navigating, especially where they are a large regional provider.
Yeah, I'm just curious to know what our options are, right?
Yeah.
Because at some point we're going to get down to that nitty gritty level of discussion, and I think it's important to know, where we're headed at that point.
100%. I think we'd
Thank
be able
you.
to find monitors fairly easily. I think we could arrange that. Again, the cost.
Okay.
Pay for the cost. I think a monitor is different than trying to find a driver because of the 7D and all the I'm forgetting the name of the license, but the commercial license that's required.
Yeah, CDLs.
CDLs, thank you. I think if we went that route, putting monitors on, it makes sense. We were actually waiting to see, is there a way, would the routing work in such a way that we would have a run or two that we don't need? Certainly, I think the change to 6 feet changes the scenario, that it might potentially go in the other direction. But using the DESI guidelines, would there be potentially an extra run or two that funds would actually be traded off, and we'd be able to say, let's just kind of swap that for monitors on each bus. So yeah.
Okay, thank you. Anything else from the committee on transportation? All right, seeing none. Brian, can you give an update on calendar?
Yes. And again, we're going to wait for some clarity on exactly what this is, but the Globe was reporting as of the other night that the commissioner reached an agreement with the three main teachers organizations across the state, reducing the 180 requirement down to 170. The reporting is that's all front loaded into the beginning of the school year. There's been some discussion about, and I think the general belief is that that's a local decision. So the committee working with the Teachers Association, that was discussed with the group. And so that there obviously needs to be more discussion, but the spirit of that is that there are some of those days used at the beginning of the year to allow us to prepare for whatever model we open up in, to make sure that we have the time to provide the training from a kind of call it a COVID logistics standpoint, as well as the training on all of the various content and pedagogy that we'll be putting into place for either a hybrid or remote plan at this point. So I don't think there's anything definitive to do tonight. I know we've been talking kind of hypothetically, waiting for this information, and we got the definitive answer right before the meeting on Monday night. But I think it would, again, it's another one of those discussions where the number of days would make a difference whether we were opening remote or whether we were opening in a hybrid model. I think certainly in a remote model, there's less of the kind of COVID logistical training needed up front, and some of those days would likely be helpful into the school year when we would hopefully be transitioning back to a hybrid and ultimately transitioning back in. So I don't think there's a definitive answer to tonight. I don't know if there's kind of opinions, but I know this will be a continued discussion with the teachers, and I think ultimately this is something I'd love to wrap up as soon as possible, to be able to have a discussion and a decision, rather to be able to tell parents when the first day of school is. I know there's many other details that they're waiting for, but I think certainly when they can expect the first day, whether that's remote instruction or in-school instruction, I think we need to be able to tell parents as soon as we possibly can. So.
I would agree with that. Are there questions for Brian on the calendar? I would just second that and say absolutely, as soon as we can get this information out, the better. I understand that the discussions need to happen, and yeah, I think there are a bunch of different strategies kind of that can be taken in talking about how days can be used, hopefully, and things like that. But yes, the sooner the better, because we do know that people are waiting on that.
Yeah, and I mean, it certainly needs to be reviewed with the Teachers Association, as this was a discussion, at the state level with the Teachers Associations. But that's not to say that you all can't have a discussion now and certainly talk about your preferences. And I mean, if I were to talk to you, I would say, again, it depends on the model. But I think we've been using the kind of hypothetical of using Monday the 14th of September as the first day of school. If we were to take our kind of local PD days and bank those into the year at some point, and a couple of the 10 state days, we would use 8 days for the week before Labor Day, and then 8 days total. So 4 days the week before Labor Day and 4 days the week after Labor Day. And we would start on the 14th, and that would give us 5 other days to use during the school year. There was discussions, in the drop-ins with the school committee, people talking about a Zoom vacation day, talking about a day where we can just say, school's not in session, everyone take a break. I think those days would be useful if we're transitioning between models. We will hopefully be transitioning between models and going towards, ultimately over the course of the year towards fully back. So I don't know if there's interest in having a discussion tonight. I mean, the PNN will certainly continue the discussion with the teachers. But I don't know if it'd be helpful for the committee to have discussion. It's certainly in your purview ultimately to confirm the calendar.
I was gonna say, is this potentially impact bargaining? I'm just wondering if this needs to be an executive session for the strategy for negotiation, or if this is an open session discussion. Because I'm assuming there's potential impact here.
Yeah, I mean, I guess, yes. So I guess that's a good question, because technically this is normally in your purview. This is a committee decision, but and it's not that it's squarely out of your purview, but now that we've had some unprecedented action where the commissioner, negotiated directly with the state organizations, it's not real clear. But that's not a bad, out of an abundance of caution, that's not a bad thing to have that discussion in executive session too, just in case.
Is that okay with the rest of the committee? If not, I mean, we've got the executive session. Paul's already got his mic on, so.
I think it's warranted. I don't think we need to do this in public.
Okay. Yeah, I mean, if it's part of the strategy, right? Then I think it fits. All right. Can you add that to your list, Paul, for executive session? Thank you. All right. Brian, update on the initial plan and the process.
Update on the initial plan and the process.
Yep.
Meaning our plan?
Yes.
Right. So as of Monday night, I was intending to get you some edits. There were minor edits for what was posted. I apologize. It's been all Zoom from dusk till dawn, or dawn till dusk, I should say. So the only two things that from Monday night I heard from all of you from that draft was that we were going to change the transportation, because the transportation talks about using the state guidelines versus the 6 feet. So I would adjust the language there so it speaks to the fact that you took a vote to use the 6-foot standard for transportation, and also some language. We talked about the fact that I have to check a box to choose what we are currently using as our default option, and that everyone agreed the best approach was we're saying the default is, at this point we're leaning towards hybrid, but that there is ongoing discussions about potentially moving towards a fully remote start. So those were the only two tweaks that you talked about on Monday night. There's no new information as far as the timeline. This does have to be submitted. This piece is still submitted by Friday. It is just a preliminary. We learned today that we will get feedback from the commissioner, from DESE. I don't know if that feedback will be, okay, looks good. Based on the fact that last Wednesday they told us that it is completely in the committee's purview. My understanding is it's going to be, there's not going to be, it would have to be pretty egregious for them to come back and say that it needs to be changed. But they promised that they would have feedback to us feedback to the committee by next Friday, which is the 7th of August. And then the final plan is due on Monday the 10th. So there was, obviously looking at that, that means that we could have some school committees and spend the entire weekend together again and redraft any necessary, changes to what is ultimately the full written plan. But the follow-up discussion to that was, many districts have said we need a couple extra days, right? So if you're going to give us feedback by Friday, we need the following week to have the committee meet, to have the discussions, to make sure that the plan that we're ultimately deciding and that you're voting is something that we're going to be able to stick with. Lots of the comments, whether talking for me, talking individually with parents or teachers, or a lot of the feedback from the community was parents are eager for this information, and I know we are all fully aware of that. But I think it would be negligent on my part to recommend something to you that would end up or could potentially be changed. And even if we gave people information as saying, if this is tentative, this is what we believe. If people get tentative information, they're going to go and make plans and confirm daycare and certain things start to go in motion. So I'm very cautious of putting anything out tentatively that has, as much chance to change as we know this all has a chance to change on a dime. So we have the potential of, rather than having the plan due on the Monday, the commissioner said basically if the chair and the superintendent write a letter to him and say, can we have that following week to hold meetings and have it due on Friday, for example. I can certainly say to you, if that was the case and the approach we took, we would have the plan done and ready so that when you approve it, it would also be ready to turn around and, moments later, send that out to parents and families and have that be a public and a complete document. So no guessing, no conjecture, no, we believe we're good, but a plan that we're going to say is what we're committing to, and shy of anything changing. Obviously, if the decision is hybrid and the data changes, we've had slight increases in the trends and in the past few days. It's not yet, I don't believe, to the rate where anyone's drawing major concern yet. But if that were to continue to trend upward in the next 3-4 weeks, certainly the decision you make that week of August 10th could end up changing. But I think by and large, we need to do everything we can to take the time to ultimately arrive at a plan that we can say we're going to commit to. So
I'll open that one up to the committee and just look for your feedback on that, because I have some definitive ideas, but thoughts from the committee? None. Okay, so here was my thought in talking to Brian, is that I understand that parents very, very much want information. I think there are kind of three big decisions that are in particular going to guide their own personal decisions. They anyone who's been on the discussion sessions, this is one of the things that I've heard, right? They want to know what the model is. They want to know what the remote option looks like and whether that's going to be in district or out of district, and just kind of a general idea of what that looks like. They want to know if it is hybrid, what the schedule, I guess, structure. I don't know how to, how those days are going to work, right?
Like?
Exactly.
Yes, right.
And then I've heard a lot of, we want more information on safety. What's happening in your buildings? How is it going to be cleaned? This whole idea of contact tracing tonight, which I think is still kind of open. There are a lot of pieces that I was hoping were going to be kind of closed, not to any, knock on Deb and Pam, but I think hopefully they'll be getting us more guidance as time goes on. We can kind of close those. But I think those are the 4 things that parents are really, really waiting for us on that. I would like to recommend to the committee that we stick to a meeting schedule even though, because one of the other things we've heard is, they want a sample schedule of what a remote day or an in-person hybrid day might look like. That can be part of the final document that Brian's working on. And to my thinking, I believe that can be pushed a little, but I want to keep us to the same schedule on those really big decisions of trying to make them by the 10th. I don't know how the committee feels about that though, because we have extra time, and extra time means more information. But I think they could give us all the time in the world and we never have the full amount of information that we need to make those decisions, right? I mean, that's what it comes down to is
And actually the one piece of information that is, again, it all goes back to that driver, right? That driving decision about what that remote option, again, the remote option, not the full remote model, but that remote option looks like, is that needs to be negotiated. So that's certainly not something we're going to have a discussion in open session, but we have had 2 sessions this week, scheduled again next week. So that is contingent on at least maybe not getting completely done, but some additional discussion and negotiation. So that is both time sensitive, but also hung up, we'll say, in a separate process.
Yeah. I see a lot of blank faces. Any input from the committee on your preference? Because we need to set meeting dates going forward. We need to be able to communicate this if they're, depending on what's changed. Tina?
Yeah, Narissa, just to kind of echo what you said, especially after the community call we had today with the Pine Grove families, I think as much as everyone's trying to do their best and we're trying to be very cautious and communicate to people that, things are subject to change, obviously, and we don't, just listening to, some of the questions that were asked of Pam and Deb in terms of the guidance that they've received in their experience, and then what we're getting from DESE, it's not completely cohesive, right? So things are subject to change, but I do think we owe it to the community and the families to stick to the 10th and put something out there. Obviously, it could be subject to change, but I think to, I don't want to say our credit in trying to keep everyone abreast of what's going on in these discussions, they need more information. We're doing this multiple times during a week and we still don't know. And even there was the comment made that parents are on these calls and following along with us and they still don't know or understand. So I think if we can stick to the 10th and come up with a plan, I think we should push for that.
Okay, thank you. Anyone else? Is there a general agreement? Can you give me, yeah, Maureen, go ahead.
No, I was just going to agree with Tina. And then I think whatever we come out with by the 10th, I think it has to be very clearly stated that things could change, but this is the direction that we're moving in. Just because I know other districts in other states and things that I've been following where they have come out with their decisions and then they've already made changes, and it just infuriates parents. And so the clearer we can be on, this is our decision, this is the direction we're moving in, but we've all
things that are out of our control.
Rapidly things change.
Yeah.
Can I jump in here, Narissa?
Yeah, go ahead.
I think we should push it to the 12th. I think we should try to get the plan by the 10th and have our understanding of what the component parts are, and then be able to ask questions on the 12th and then vote it on the 12th. That's what I believe. I believe that Brian and I agreed today that for Commissioner Riley to request a plan to be voted on by the 10th was very short-sighted. And that's a nice way of putting it.
Yes, that is a very nice way of putting it. So your suggestion is, so our proposal, before this came up earlier, was it this afternoon? I think Brian and I talked about what the commissioner had said earlier today.
I think so.
Was to actually meet on Friday to give PNN time to hopefully work during the week, to give the administration time to work on drafting, basically. So that, at that point, thinking that a final plan was due on Monday, and then to meet on Monday for sort of the final blessing. So it would be a Friday meeting and then a Monday meeting. So I'm reluctant to push farther than Friday. And I feel like if we pull that earlier in the week next week, that that's going to be putting a time crunch on Brian and Kim that is not fair. And on PNN as well, assuming that those discussions are going to go on. So I don't know how the committee feels about that. If we can stick with a Friday and a Monday, and then potentially add a Wednesday if we need to put a stamp on the plan itself, not just the big pieces, but the entire plan, and then submit that. And we can request a waiver.
So can you just clarify that? I'm sorry. So you want the schedule next week to be Friday next week and then Monday the 10th?
Mm-hmm.
Okay.
Yeah.
That's what I'm,
Wednesday the 12th,
not
too.
Wednesday also?
If Paul is saying Wednesday the 12th, so I believe that we need multiple touch points through that. If Paul is suggesting though that it actually be that the final final subject to change plan, right? If dire things happen, be submitted on the 12th, then I'd assume we'd want to give the administration right up until that time to make any last minute tweaks, because we have to vote what actually goes through.
This is the important vote, right? This is the final plan. And then to Maureen, you moved, where did she go? To Maureen's point of, when we arrive at the plan, we want to all feel confident in the plan and believe the plan's not going to get undone by continued negotiations or, a shy of medical data forcing a decision to a more restrictive model. We want to be able to stick with that plan. So I would just say, I think over the course of next week, there are potentially some major decisions through negotiations and other aspects of these moving pieces that hopefully will come into alignment, so that by Friday we would have a document. I don't think it will be a pretty all done document, but if we have the kind of the nuts and bolts of it to talk about, that then we could talk, have some feedback, or you could provide feedback over the weekend. We could put it together in a more formal document for Monday, provide that, by the time we meet on Monday, and then any further tweaks, discussion. I think at that point we would have something, if at that point we had a formal final looking document, but again, we were talking about tweaks and details, at least I think we could agree that, the nuts and bolts weren't going to change. And those people listening to that conversation would know, all right, we talked about a couple tweaks here and there, and then it would just be a matter of those tweaks that we bring back on Wednesday for a vote. I think, we'd be able to have some pretty concrete information by the end of that meeting on the 10th. But then, allow more opportunity if there are other tweaks that need to be made.
Does that answer your question, Aaron? You're muted.
Yes, but
Okay.
when you're when you're making the statement, just list out all the dates so everybody here is clear. Like we're looking at Friday the X, then Monday, and okay, just so that everybody can get it, because I'm trying to keep track of them.
Yeah.
I think it'd be Friday the 7th is a working document. Monday the 10th is a draft document for final forever hold your peace feedback. Come back on Wednesday, 48 hours later, with a finalized document asking you to vote that. But I said the date, that would be Wednesday the 12th.
That makes more sense. That makes it more sense now that I was able to capture the dates and the specifics. Thanks.
Really need to invest in dual monitors at some point so that I can actually look at a calendar and a Zoom screen at the same time. Tina, did you have something to add, or is that a leftover hand?
Oh, that's a leftover hand. I'm sorry. I'm on my phone. I'll
sorry.
lower it.
I didn't lower. That was my job. I didn't lower your hand.
It's okay, Brian. I forgive you.
So preference, is that a preferable, D plan that people want to go with?
That does make the most sense.
Paul's good. Tina's good. Yes? Okay, I see lots of thumbs up. All right, so that'll be our plan. So it'll be the 7th, the 10th, and the 12th that we'll aim for on that. And hopefully that'll give us some good, unfortunately with all these meetings, the problem is there's only so much time in between them to do the work. Right?
There are a full 24 hours in every day.
Yeah, exactly. All right, so that's that plan. So headed into kind of the process that we've been going through. Brian, can you take us through the general survey results as far as they exist today? Please.
Sorry, I'm just writing myself a note. Hang on. Friday. Yes, so I shared with you, let me pull it up. There's 17 individual files. So there is I'm just going to work from the summary data rather than attempting to go grade by grade. You have the aggregate data broken out, filtered by grade level. So you can see preschool through 12th grade. You have 14 different files to show you all the responses for each grade level. And then you have the summary data, which I'll just kind of walk through quickly. And then you also have it's called a stacked compare. So you have all the responses as a proportional bar graph, graphed by grade level, and then also graphed by those who require services. So require IEP services, 504 services, English language learner services, or no services. So those were the kind of the various asks for Narissa as she was going through data that thought that made sense to give you lots of different views of the data. But going through the summary data, as of this afternoon, there were 1,480 responses. There was a question, in regards to the fact that this is an anonymous survey. So this is not the ideal way to survey. Ideally, we would be asking for parent name and student name to be able to verify all of the responses. At this point, this is about, I keep hearing the word dipsticking, right? This is about getting a sense. This is not a data set that we would make all of our decisions on, but it's a piece of information to guide. And I think it fairly well aligns with what we've heard from people. So just to make sure that's clear. So again, close to 1,500 responses, pretty evenly split. If you look at enrollments, I would say the only school who was kind of disproportionately represented in the results was Newbury Elementary. Was a larger percentage compared to their enrollment, and Salisbury was slightly underrepresented, underrepresented based on their enrollment. They are the largest elementary, and they had the smallest sampling. Continuing through, so question 3, please make a selection below as to whether your child is in one of the identified subgroups. So we had 16% of the responses were those with students on an IEP. Roughly 10% were those with students on a 504. Under 2% English language learners, and about 71.5% students who their child was not on any type of plan. The question, if all social distancing guidelines are met and safety precautions are satisfied, would you consider sending your child back to school for full-time in-person learning 5 days per week? Almost a perfect 2/3, 1/3 split. 2/3 of the responses said yes. 1/3 of the responses said no. If I were rewriting this question, I would probably be a little clearer in regards to were we asking based on DESE's guidelines or the 6-foot guidelines that you voted? We went back and forth. There were different questions that kind of alluded to that vote. There's some clarification up at the top. But again, I think that question could have been worded a little better. Question 5 was, even if all social distancing guidelines are met and safety precautions are satisfied for a full in-person person model, would you still prefer to have your child engage in full remote learning? This was almost a perfect 3/4 of the responses. Almost 75% said no. Roughly 25% of the respondents said yes. So that was 373 of the 1,480 respondents. The next question was...
Brian, can I stop you for a minute?
Of course.
So from those 2 questions there,
yep,
majority of our parents want the kids back in school?
So so 75 or, I'm sorry, so that's a 2/3. Yes, 2/3 said,
75%.
Yep, 66% said yes, if all the safety precautions can be met, we would prefer in-person learning.
Right, okay.
Yep. So then the next question was, if we ended up with a remote model, would you still choose, I'll try and summarize these rather than reading the full question. If we choose a remote model, would you still choose, I'm sorry, if we chose a full in-person model, would you choose the remote option? 25% yes. Then the question was, if we chose a hybrid model, would you choose that full remote option? And again, it was 23%. So almost similar, almost exact, roughly 3/4 no, roughly 1/4 of the respondents saying yes. Then there was 564 open responses. That has not been quantified or analyzed yet. And unfortunately, quite a few individuals use student names in their open responses, which then allows us that is then technically a student record, and we can't divulge those names. So they're certainly going to do some work to analyze those responses. So this was in, and again, this was a scenario. So if we landed in the hybrid model, you know, basically said we are looking at alternating days versus alternating weeks, and said which of these three would you prefer? And I will say there was some questions about and comments about people didn't want this to be a all of these questions were required. So to continue with the survey, you had to answer, and I think that was very intentional in that this wasn't saying, do you like the hybrid? This was saying, if we went hybrid, we want you to give us an opinion on which model you would believe is the best. So the three options were true alternating every other day. So 1 week you go Monday, Wednesday, Friday, and the next week you go Tuesday, Thursday, and the next week is Monday, Wednesday, Friday. So truly alternating each week. Or 2 days set and a Friday either alternating or a Friday always remote. So be a Monday, Wednesday in school every week, Tuesday, Thursday if you're cohort B, and then we alternate. You are in person every other Friday, or you're always Monday, Wednesday, always Tuesday, Thursday, and then Friday is always remote. That was, it ticked up, at one point it was literally off by hundredths of a percent, but currently it's, roughly 46.5% versus 45%. So it's almost a statistical dead heat there in regards to those two options. And then there were 8.5% who chose the truly alternating every other day. So clearly the alternating every other day is problematic, but it is, again, a statistical split in regards to whether or not that fifth day, and again, in this example, it was the Friday, whether that be alternating in school each week or just a straight remote each Friday. And I guess I would argue that those who would vote for the remote each Friday would be somewhat about the consistency at that point. Also, again, not going to go through every grade level in detail, but also interesting when you start to unpack this question based on grade level. In regards to student transportation, again, almost 34%, they would feel safe placing their child on the bus if it was one per seat and following the DESE guidance. Another close to 16% would say, I feel safe placing my child on the bus if it was every other seat, which is the 6-foot model that you have currently voted to adopt, and until we have any other further decisions that would preclude that from happening. So that is, roughly 50% at the 6-foot distance would choose to ride the bus. Just under 26%, 25.8% said they do not feel safe in any of the circumstances and will not place their child on the bus. And then another 24.5% said that their child has alternate transportation and does not plan to ride the regular bus. Question about anticipating accessing school meals. 8.5% plan on accessing meals both in school and remote. Again, just to confirm, we do have to offer lunch on remote days as well. So as we are planning and provisioning in our cafeterias, we're talking about having to make sure our staff are available to produce lunches for in-person. And again, while there'll be hot lunches and they'll be very different than the grab and go that were in the little bags, we do have to provide, they will be grab and go format, but it will be hot lunches and there's many more options. But we do also have to have remote or lunches available grab and go for all students who are home on a remote day. So we're working through the logistics of, is that a curbside pickup? Is that something we can continue to partner with our Neighbors Table and Boys and Girls Club to have volunteers drive and deliver as we have for some families? So that's still a work in progress. So 8.5% said they want lunch all days. Close to 37% said on the in-person days. 2.5% said on just the remote days, which is an interesting number. And then roughly 52.5% said they will not access the school lunch program.
If we have questions.
So
Of
can I
course,
ask,
yeah.
I'm sorry, Paul, go ahead.
Yeah,
No,
if you guys want to stop mid-survey, that's fine. I was going to handle them all at the end, but it probably makes more sense question by question.
Go ahead, Erin.
Okay, so I was just gonna say that this question I think when I looked at it again was a little confusing. So maybe that 2% was somebody that assumed that they would have hot lunch, so they would only be asking for the additional service outside of the days that they would have expected to be in school. And that's what my interpretation of that would be.
Okay.
That's a relatively small number. Paul, go ahead.
My question went back 2 questions, the 2 questions before this about busing. So Kyle, on these numbers, based on who's wants to put their kid on the bus, who doesn't feel safe, they're going to put the kid on the bus. And then the third is we're going to use alternate transportation. On those numbers, and granted, we've only got 1,500 responses out of 2,400 families, but is that going to require extra bus runs based on the numbers as they are? Or can we get by with 12 kids on a bus?
Right, and that's I wish I could answer that specifically, but that's exactly what we have to understand is what did our ridership look like last year? So it said 50% don't plan on taking the bus at all. What percent didn't take it at all last year? How do we stack up against that? And kind of like we were saying before, of having to back into it a little bit. So I can't answer it directly, but that's certainly exactly what needs to be ironed out.
Yeah, I mean, I think we have to drill down on that, because if we're still considering a hybrid at all, that's a number that we've got to do a better job at crunching and finding out whether one bus run does it each morning, or whether we have to somehow stagger times and do all that.
Yeah, no, that's what I was saying earlier, is that on paper, straight calculation, we have to stagger times, right? So just using the 50% number, assuming most buses ridership wise had 45, 50 students on it, running them a hybrid model, half the students each day, half the student capacity, we can make the 24 students work with the one student per day. I'm sorry, 1 student per seat. But just again, purely on paper and doing calculations, when we cut it to 12 students, we wouldn't be able to do it in a single route each day. So we would have to do double routes at a minimum. I think it goes back to your question. I agree unequivocally. My hope is to be able to ask that a question very clearly as soon as possible. But as I had mentioned earlier, speaking with Narissa, I think it's hard to ask that question and say, do you plan to ride the bus? And many parents will say, I don't know yet, because I don't know if I plan on doing the optional remote. So what I don't want to do is put out another survey and put out a question that we're going to use as a definitive answer and say we're going to start provisioning and planning for buses, when there's still a potential 25% of families, when if you apply that 25% to all 2,400 students, that's 600 students who could be choosing remote, and they come completely out of the mix. And maybe we can do just a single tier with the hybrid model. So I think, again, it comes back to that, unfortunately, again, comes back to that remote option. And then once we make that call late next week, we'll be in a position to look at a shell, working document that would be able to start to answer that question. And then we'd be in a place, as we're finalizing the plan, to also ask that question very, very distinctly, and ask for a commitment. Yeah. But even then, back to Kaylee's point, we can't ever really fully follow through on that, because state law requires that we transport our students. So.
Did that answer your question, Paul?
Yeah, but I mean, that whole comment about state law, yes, we have to transport them if they want to be transported, but if parents opt to bring their kid in individually because they think it's a safer course, then that takes care of that issue.
Oh, absolutely. But I'm always saying, when it goes back to the family who says, I'm not going to ride the bus, and then says, actually, you know what, I do need the bus, I'm feeling good about it. We need time to be able to plan for that, because my understanding is we can't say no to that. We can say, you know what, give us a couple of days to set it up. And that's probably, I think Desi would support us there. But ultimately, if a parent pushes and said, I need transportation, we would say, yeah, we're obligated to do that. And we would absolutely commit to that. So.
You step, Paul?
Yes.
Or as as you're going to be. Kaylee?
I was just wondering if with the survey, there's a way that we can cross-reference how many parents had said that they would choose to put their kid fully remote with this number of results that we had gotten for I do not feel comfortable sending my kid on the bus, to see how that overlays.
Yes.
Yes.
The answer is yes, because we can get this out in Excel and then do pretty much whatever we want with it. It's just a matter of not being able to do it on the fly during this meeting.
Yeah.
But that's a,
Yes,
that's something
SurveyMonkey will not spit that data set out, but
Right.
the raw data that we have in a file, yes, that can be compiled. Yes.
I feel like that would be very useful in the breakdown
Mhm.
to be able to cross-reference and see.
Absolutely.
Caitlin, was that a hand or? No. Okay. That was just a reach, I guess. Brian, you can finish, I guess, then, or move along, and I'll try to keep a better eye
I was
for
going to say,
hands and people trying to get.
I think we ended with meals program, correct?
Yep.
So then the question is, if we return hybrid or fully remote, will you need childcare? A quarter said, yes, I need to find childcare for any days when my child is home. About 11% said, I'll need to find childcare on the fully remote model, but on the hybrid model, I can likely find childcare for 2 to 3 days a week. And then roughly 65% or 64.5% said they do not need to find childcare. So again, on that point, we are working with Chris Bevilacqua, the director of the executive director of the YMCA of the North Shore, and so they are working to open up we'll call it a program at Camp Cedar Mill in Rowley that we know definitively is accessible by Rowley and Newbury parents. Because that's officially the YMCA's catch basin, but we believe we can open it to Salisbury as well. And it would be a tuition-based program, but they would be looking to set the program up, knowing that students who are there for those days are on a remote learning day. So they wouldn't have teachers per se, but they would certainly have people who are able to work with students and keep them engaged on learning. Question about dedicated devices. So 56% have a dedicated laptop, PC, Windows, or Chrome device. 7.5% say they have a dedicated device, but it's a device, a phone, a tablet. About 19.5% say there's a shared laptop device. About 5% say they have a shared Wi-Fi enabled mobile device. And then 12% roughly say they have no access to a device. So again, the discussion, this actually was discussed with the technology committee too. And the question asked, well, if half of the population says they have access to a device, is that wasted dollars? So, our approach has been, in that realm of a PC, you might have folks who have an old Windows 7 computer, or a Windows XP, or a Windows 10, or a new Windows, or an old Mac, or a Mac with old Mac OS, new OS. So it was ultimately the decision to move towards a one-to-one model for Chromebooks was based on the fact that we're giving the same device to all students, and then all platforms that we're asking anyone to access remotely, web-based resources. We know that we are going to make sure they work well with a Chromebook, and then have a single platform so that we can make sure that when we're supporting devices, we're not also fighting with technology. Technology just becomes a tool rather than a potential distraction. And then the final.
Hang on. Kaylee's got a question. Go ahead, Kaylee.
So I know on the high school level, and I know it's been integrated on the younger levels as well, there's a lot of times where we'll pull in the Chrome cart for a certain lesson or to write one specific essay. And since we can't really do that, is it going to be expected if we go one-to-one that we will be having our Chromebook at home and then bringing it in on our days in, and
Yes.
vice versa?
Yep. So everyone will be assigned a device and keep the device. Yes.
A few people had reached out to me asking how that was going because of in-class essays and such. So
Yep,
I just wanted to.
Yeah. So I mean, part of this was, in the COVID world we're living, we're supposed to limit how much there's sharing of anything. So that certainly passes that test. But this would be a big initiative just to make sure we didn't have to wipe down devices. So I think ultimately, long term, we'll see how this works in regards to younger children. Is that best to have it going back and forth, getting cases, and certainly getting all those materials to make sure they're safe. But a first grader carrying it back and forth every day may not be the best option. So we're certainly working through that. But at the elementary level, part of the hybrid model that we'll talk in more detail next week is actually utilizing the computer more when students are in school with the teachers. So it becomes part of the normal, regular kind of MO, so that everyone's comfortable. And then when they're home, again, not everything should be on the Chromebook and on Zoom, but that there's more familiarity, so it's a more consistent use of the device. So great question. I think that was the only question. All right, so 2 more questions. Internet, a reliable internet. A little touch over 96% said yes. A touch under 4% said no. We do have access to some cellular hotspots, and we do have funding from a private donor to be able to purchase more of those. And those would be in the spring. We worked with families who identified, so we'll certainly that's 57 individuals who identified, and we'll certainly do a more formal request to make sure we're identifying those families. And then again, the final 883 open responses to what are the most important factors we should consider and haven't asked about. So I'll stop there. And I don't know, Narissa, if you want to walk through any of the other documents, but I think mostly it's helpful to just, as you're unpacking it, to be able to unpack it by grade level and the other services as well.
Yeah, no, so I'd open it first for questions from the committee on any of the questions on the survey. All right, and I know Paul, Mayette, Caitlin, and I all had access to the raw data, which could take you a step farther. I know everyone else had access to at least the canned reports. If you want access to the raw data minus the open response questions, of course, Brian can give you access to that. It allows you to do the number crunching that Kaylee was talking about. That's beyond what SurveyMonkey can do, so that you can get kind of really down into the data and slice it and dice it the way you want to. But I would just open it up to anybody. I mean, I have a few observations based on the different reporting that I saw there, but I was just wondering, I'll open it up to the rest of the committee first. Who has anybody? Paul Mayette?
Yeah, I'll just the one observation that I shared with you earlier was that I ignored the options for full day, since that seems completely in, since that seems to be off the table right now, and looking at that question 6, I believe it was, where it was, if we go hybrid, would you pull out, would you want remote as an option? And I crossed that with the number of people who said they need childcare. And I just did notice a big uptick percentage-wise in if they answered yes to I need childcare, they were much more likely to say that they wanted that they did not want some form of remote learning, or the full remote learning. I'm trying to look at the numbers right in front of me, but and that also went up significantly more if you broke it out for just elementary. You took the high school and middle school numbers out of that. It was anybody who needed childcare in the elementary specifically was far more likely to say that they were not interested in full remote. So that Cedardale piece that you mentioned it'd be interesting to see how that response changes as people learn about that as an option.
Yeah, thank you, Paul. Any other comments on this? I had a couple that I just thought were interesting, and that was, I initially looked at the stacked report by grade and thought it was just too busy and there was nothing to be taken out of it. And then I noticed something that was pretty interesting. Well, first of all, if you look at grades overall broken down for the full remote questions, or the remote option questions, I guess I should say, and the hybrid options, one of the things that that you can see in the results there is that there tends to be a higher desire for the back to school full and the hybrid in the upper grades. But one of the things I thought was interesting was that when you break it down on the question of full remote versus, full in versus versus the remote option and hybrid versus the remote option is that as you switch between those, what it looks like happens kind of in general is that as you go toward the hybrid option, you have more elementary families that are willing to come out of the individual remote option and come into the district model. But you actually have the upper grades go the opposite direction. So as you go from 5 days full in, and you look at that versus the remote, there are fairly high numbers, and they actually go down once you look at the hybrid versus remote. So what I took from that, and again, it's a generalization, sometimes it can be 8%, 12% difference, is that elementary families, there are probably a significant number of them that are uncomfortable with sending their students back full time, but would be comfortable with the remote model over when the alternative is the remote option. But at the high school level, once you take them out of the full 5-day option, there are some that instead of going into a hybrid model look like they would go to a remote option overall, coming away from that full 5-day option and down into the hybrid model. So I thought that was really interesting, just in general. And you can, it's not huge numbers, but you're looking at a difference there that seems to be happening in those couple of questions. I thought was just really interesting because it wasn't something I had thought about the effect of, hybrid versus full and the way that might affect families with the remote option depending on grade. Kaylee?
I was just wondering if I could maybe really quickly speak towards the whole that high schoolers were more willing to do the remote over hybrid.
Yeah.
I think because personally, a lot of people I've heard from, they really liked the flexibility of the remote option as opposed because it allowed them they knew what their work was and they could get it done in the hours that worked for them. Which I think a lot of people don't understand isn't going to be how it's going to work this year. And it's also the fact that there were so many inconsistencies with remote for us back then that I think we're thinking if it goes hybrid, that's the inconsistency of in school during COVID, and it's also the inconsistency of online. So it's mainly just there's too many unknowns. I think if and when the final full plan is released, if we sent out that information again, it would change. And if we also sent it out to the individual students as opposed to families.
Good point. That's interesting. I didn't want to describe or ascribe a reason to that change, but I mean, that's definitely makes sense. Yeah. So, and I'm assuming, I don't know, I mean, I would be curious about open responses, Brian, on it, but I'm assuming that it's safety, that there's the perception that there's more safety at the elementary school level in a hybrid model with fewer students in a classroom, because I know that's something at the elementary level that I hear a lot from parents is, can they respect a 6-foot boundary? There's going to be more, fiddling with masks than there would be at, from an older student. So I think I'm guessing that that's a safety thing where they're just figuring if there's fewer students in the classroom, that overall makes it safer. So, that one I could go to. I couldn't speak to the high school one at all. So I guess my one big comment on this too, Brian, is that that obviously there's a good portion of the families that would look at that remote option, and even when you look at it broken down to the grade level, every grade, I think the lowest one was 13% on either of those questions. So it's a significant portion of that student body that would be looking at the remote option. And I think we need to, as we're having our discussions, kind of weight that accordingly, because I think we didn't know before, right? I there were nationwide polls that were out. They were kind of, I don't want to say they were all over the place, but some of them said 10% and some of them said, over half would look at, a remote option versus sending their child back to an in-person school. And I think, this gives us not a perfect understanding of where our families are, but it gives us a much better understanding. And I think it's, it's higher than it might have been. I guess.
No, absolutely. I think,
it's,
making the assumption that it's 20-25%, a quarter of the population, that's 500-600 students, and that it's broken down fairly evenly, right? That was what we were saying. And again, assuming this data set is representative, it's not just focused at the high school or lower elementary school. The fact that it's spread out makes it more challenging, because there won't be a chunk of students that frees up staff, but by the same token, more workable because they're evenly spread out too. So yeah.
Yeah, one of the things I was curious about was breakdown versus school on those questions, and that's one of the things, just having the raw data that I can go ahead and pull out, because I don't think that was in there. If we were looking at each grade, right, a grade, how many of those the students in that grade that opted for that option were at, let's say it was second grade, how many were at Pine Grove, how many were at Newbury Elementary, how many were at Salisbury Elementary? And I think that I'd be curious to see that as well, because I want to know if it's focused in one school versus another. Although I think, as we had said before, it's not like we have to treat, when you're remote, it's not as important, right? What school you attend, so to speak. Maybe you could look at an inter-district model. We had talked about that on Monday. So, but I'd be curious where those students fall. Yes. So, any other comments from the committee on this, Kaylee?
I was also wondering, on the middle and high school level, do we?
You're unmuted, but we can't hear you.
We can hear her.
You can? Oh, I couldn't.
I was wondering if on the middle and high school level, we can access the data of what town they're from to see if the towns feel, if there's a direct shift on how the different towns feel, not even just the elementary schools, but the towns as a whole.
I don't think we asked that question, right,
I was
Brian?
going to say, yeah, this is anonymous, so there's no way to link that to our data. So no, there is no way to break it out by town.
Okay. No. But we do have the breakdown between the elementaries.
Where it was, yeah. So one of the questions that they had to choose was which elementary school so they had to choose grade level, elementary school, and
middle
if they had services, what the services were. Okay. Yeah. So we can sort the remaining questions by any of those. Yeah. So, and I know this was asked today, Brian, I'm just following up on this, but the general summary, I know parents were hoping to get a look at that and see what that looked like. Is that something we can put on the Stay Connected site?
Absolutely. Yeah.
Okay.
Look at that pod. So that would be the report. So you all have seen that. I'll post it as a PDF. I wonder if I can post, I might be able to figure out how to link the live data so people can click right to it. But yes, I will absolutely get that on the website.
Thank you. All right, so kind of moving along in this process that we're still going through gathering public feedback, we have had 3 of the 6 discussion forums, and I know there's a number of school committee members that have attended those. We've had at least 2, I think we maxed at 4 on one of them. I was just wondering if any of the school committee members that attended those, so it would have been the Salisbury Elementary focus, the Newbury Elementary focus, and the Pine Grove focus, and just, I guess, give your impression, provide some feedback on what you heard, anything surprising, anything that stuck out to you. I've attended them all, so I'm gonna let you guys go first. Nobody? Maureen?
So do you want trends? Oh, sorry. Yeah.
I think just your general impressions, right? Because part of this is just discussion. It was, what did you hear that surprised you, that were areas of concern? What did you, what stuck out?
I don't think there was anything that surprised me. I attended the Newbury one, and I don't think there was anything that surprised me. I mean, my guess is that the questions asked were probably pretty similar from each of the elementary schools. I mean, there were a lot of questions on masks, mask wearing. One question was asked, which I thought was, is there any type of mask that would be acceptable? So we might want to think about, you know, just making clear what we want parents to be sending in for their kids. Just, you know, a lot of questions around transition, like if we're transitioning, how, you know, from fully remote to hybrid, how is that being worked on right now? Yeah, I mean, I wouldn't say there's anything. It's all really great questions and well attended. It was nice to see so many parents attend.
Thank you. Erin, did you have?
So some of the topics that came up that we haven't talked about kind of made me think a little. There are a lot of open questions along the lines of how would remote teachers be assigned, that sort of things. I think there was kind of an understanding that if someone decided that they would be remote, that they would still be allowed to participate with their child's classroom if they were fully remote, that sort of thing. But then we got into some of those discussions about what the cleaning would look like and providing the picture of the classroom. I think that's pretty eye-opening also, of what the spacing would look like and being able to see what the setup would look like for a classroom. Then going into how the bathrooms would work, that's something that, you know, hadn't even crossed my mind, but that's something that we did talk about a little bit from the SES crew. Some of the concerns that we raised with the public health officials, like whether or not everybody would be notified in a room if somebody had the symptoms, you know, and that prompted my question as to if we do have the symptoms versus somebody that actually went and got the test versus somebody that didn't feel comfortable going to get tested, whether or not the other parents in the room would be notified. So those were some of the big things that really made me think a little bit more beyond what some of the discussions that we've had.
Perfect, thank you. Caitlin? That was a hand, right?
Yep, sorry.
Yep.
I wasn't reaching that time. One of the things that came up was, I think it was one parent in particular, but it was echoed after it was said, that they really want to see a full dry run from like the start of the day right through. And I know we've talked about that too. And then we actually had a public health nurse on ours. So that was an interesting point of view we got, where she was making changes. But mostly it's everything Erin said, and then it kind of echoed where we go here, minus there was a huge talk about work balance when it came to remote and how that was affecting parents who, you know, worked different shifts and kind of like one worked an overnight and one came days. And they were talking about that balance and then the need for kind of figuring out how they would connect with the teachers because of that. So yeah, the big thing was the dry run. They really want to see the day.
And the drills. So
And the
coupling
yeah.
on that, they want a drill to what happens if somebody is sick in the classroom, what's going to happen.
I couldn't read what I wrote.
Oh, okay.
For dry run.
Yep.
Thank you.
Thank you. Mr. Lees or Mr. Goldner? No?
No, sorry.
Yes, Mr. Lees?
I guess the only thing I would add was I was just surprised. I listened to it on Rowley. I was surprised at some of the passion in the people's voices who were speaking economically and saying, if we do anything but full return or significant hybrid, how are we going to get our kids taken care of? And we need to return to work. And I know this all intersects with the unemployment being, you know, drying up and going away and people having to go back to work on some level. So that was the only thing that I took note of that I didn't, you know, I just hadn't heard before, hadn't heard people express it. But obviously it's common knowledge.
Mm-hmm. And thank you. Paul Goldner?
I would just echo what Maureen said. I felt like there were a lot of questions about the details that we don't have answers to yet. And, you know, parents are interested in those details because that's the day-to-day routine that families are going to experience. And unfortunately, there's, you know, nothing we can do about it yet, but those questions are out there and of concern.
Thank you. And I think that was it, right? Did I miss anybody that attended one? Tina, right? Yeah, Tina was on this
Yes,
morning.
yeah, no, I was,
Sorry,
yeah, I
Tina.
was, no, that's okay. No, I was there today. I mean, I think it was great. A lot of parents asked specific questions, especially for high needs populations and what it would look like with kids on IEPs. But to echo what everyone's saying, I think people are just really craving the details that I'll go out on a limb. I won't speak for the committee, but for myself, that I'm craving as well. I think we're all hoping for those answers. So again, just seeing how we're working with the guidance and even listening to Pam and Deb earlier, and just the gaps between the health department and the education department's kind of alarming, which just goes back to this being a logistical nightmare. So obviously we're trying to do the best that we can, but we're not going to make everyone happy. This is the first time in history that we're doing this, and I think everyone needs to remember that. And I'm going to go out a limb without sounding completely insensitive, because I'm a working parent and we have 2 working parents in this household, but our schools are not babysitters. So we're focusing on education, and I think people need to understand that as well, and we're doing the best that we can. But I thought the call with Raleigh today went really well.
Thanks. Maureen, did you want to add something?
Yeah, so sorry, I was just reviewing my notes and I just noticed something that I wrote down that I thought was an important point that a parent mentioned when we were discussing remote learning. She was talking about, you know, her experiences with the springtime and just how difficult and challenging that was, as we all know. But she kind of made a suggestion that if there could be if we do go to a remote model at some point, could there be guidance for parents on just, you know, helping them set schedules for their children? Like, you know, this is stuff that teachers do in the classroom. Parents don't typically have to do this kind of thing in the home. So if they could just be given some guidance on how to best help their child in setting their schedules. So I just thought it was a great point. So I wanted to mention it.
Yeah, thanks, Maureen. So I attended all of them. Actually, I was the host, just in case Brian was late or couldn't attend one of them. So, which did happen.
He was late.
He was on a staff meeting. So it was a small moment of panic, but he showed up. So I guess to kind of echo what everyone else has said, I've definitely heard the need for us to see different perspectives, and I would agree with Tina that no one is going to be totally happy with whatever happens, because there are so many different perspectives out there. And it was kind of interesting. I think it was Paulise had said, or somebody said early on, that they thought it was probably similar. And I thought, Brian was on them all and Kyle was on 2 out of the 3. I thought they were quite actually dissimilar in where their focuses were. There was a ton of focus in the Salisbury Elementary one on the remote option, the optional remote, whereas we heard a lot from Pine Grove parents on the focus on like a district remote learning model and how that would be different, and just on the need for them to have an in-person model. So I don't know if you noticed that as well, Brian.
I was just gonna say, I feel like the common theme from all of them so far is the remote learning, whether that be an optional remote so parents can make the choice to select that as an option, or the remote where we would be in full remote daily, or the remote component of the hybrid model. I think several have said that. What does a day look like? So basically, when I'm my child's teacher for a day, what do I have to do? And please make sure it's structured. To Kaylee's point, people answering the question thinking, hey, I could get it all done in 45 minutes and I'm good to go for the rest of the day. That is not the spirit here. that this is, you know, the spring was very different. It was an emergency response. This is time to plan and be thoughtful and have an instructional day. Students at home still will be engaged for the balance of the school day. It doesn't mean we want kids on Zoom of any age from, you know, 8 o'clock in the morning to 3 o'clock in the afternoon, but a mix of synchronous, asynchronous, independent work, project-based. It is going to be a day of engagement. So I think that that's helpful for people to hear. And at the same time, it's hard for people to hear because they hear, oh, I've got to figure out a whole day of scheduling to make work with my family. Again, two working parents, you know, other siblings needing to be on at various times. So that was, I would say, the overwhelming response I'm hearing so far in those sessions and everywhere else is, can we please get clarity around the remote plans? And I can promise you that's coming next week.
I'll come to you in a sec, Erin, but I had been kind of trying to class things as I was writing them down. I was trying to write down all the questions that were coming in the commentary. And I think I could class them into 5 different things. One is definitely the solidness, I guess, or solidity of that of a remote model, whatever, or a remote option, whatever that happens to be. Communications was another one that I heard. How do we have, you know, expectations set? How are assignments sent out? That type of thing, whether it's remote or in person. Definitely a lot of concern about kiddos that need special services, whatever it happens to be, and how they were going to receive those services and the quality of those services. The whole topic of safety, restrictions, cleaning, literally down to, there was one woman who asked about which specific cleaning supplies, and I think all that's important. And then this kind of general idea of the feel of school is going to change. And we heard a lot about, can there be social stories? Can there be walkthroughs? Are we going to be able to get a look inside what a classroom looks like? Can you show us what a day looks like? Are we going to have kind of an idea of what existence in a remote platform looks like if we're on, you know, a hybrid model or full remote model? So I think almost everything I heard could be classed into one of those 5 sort of categories where there were a lot of either just questions or concerns that to a large degree we can directly affect. That's where I kind of categorized all of them as I was going through. Erin, did you want to add anything?
So I was just going to add to Brian's that a lot of the conversation about the remote interactions, they were really speaking that they wanted to have that interaction with a Triton teacher to make sure that the interactions with the students that were working remote, if a family did decide to do full remote regardless, or if the hybrid model was going into play, that they were actually interacting with their Triton teacher or a Triton staff person versus having to interact with the state and act out on the plan on their own.
Yeah, good point. Anybody else have anything else to add on that? All right, so the next 2 are tomorrow, middle school and high school, and then we did that open community one because obviously this is going to affect everyone. So that's on Friday, and I've actually had questions from a number of parents if they missed the one for that kind of focused on their school, if it was okay to come to that one, and absolutely. I kind of anticipate that one's going to be all over the place. The idea with focusing them on specific schools was that we believed that there were commonalities in the concerns for those schools, and obviously what is concerning to a high school student who might attend the high school session is far different than what's going to be concerning to the parent of a kindergartner that's going to attend, say, a Salisbury Elementary School session. And that kindergarten parent is going to have more in common with, say, a 4th grade parent than with a high schooler. But absolutely, that Friday one is open, and I would say these have all run over at this point. And we're just, it's been nice to spend the time. I've had good feedback of people saying, you know, I love the format. I really appreciate that you took the time to do this, found it helpful. And then, you know, I actually had a few that said, if you decide to do this again, let me know, because I would welcome the chance. Even people that didn't speak didn't ask a question. Just wanted the opportunity, you know, where concerns were being aired and questions were being aired, to have the ability to just come and listen to those. So that's there as well. All right, let me go back to my list. So real quick, on the other DESE documentation that was released, are there any open questions or concerns that we feel like we need either as a committee or the administration to address in the final plan? And I'm just gonna say, this is where I in part added this on here because of my gym question, where I'm not sure that what's in DESE's documentation matches kind of the general consensus of what's safe in that environment. And I want to make sure that we're, you know, we're erring on the side of science again, rather than, you know, what DESE decided to put in their document, which may or may not be science-based. All right, seeing none. We've got dates set. Oh, we need a time for Friday. Oh, go ahead, Caitlin. Can you unmute?
Kaylee.
Oh, Kaylee, sorry.
Kaylee has
Go ahead, Kaylee.
I know a bunch of people have contacted me in regards to the extra guidance that was released.
Mm-hmm.
One of their concerns was the fact that for physical education, it was suggested that like track and field and running were suggested activities, but you can't have theater. So many high school students reached out to me with that being one of their biggest concerns, that we wouldn't be allowed to walk across the stage and to talk, but we could go for a run together.
Mm-hmm.
So I just wanted to let you know that
I appreciate that.
Yeah.
The theater community is definitely very vocal about their concerns that if sports or physical ed activities are happening, they will push back to do it in any regard, even if they have to do a show outside.
Yeah. So I would say, I'll come to you in a second, Erin, we can be more cautious. We can't be less cautious than DESE guidance. So while I may not always agree with DESE, we're kind of bound in that regard. We can't be, you know, we can't relax what's set in place for theater, but we could further restrict something else. I'm not sure that that would be a good option here. You know, it's something that the committee could definitely discuss if we wanted to, but I don't know that limiting it further than DESE has already limited it is a good idea, because then we just continue to limit everything. So thank you though, Kaylee. Erin, did you have a comment?
So Kaylee, I just wanted to explain a little bit because I'm involved a lot in the youth sports too. It has to do with the indoor versus outdoor. So some of the activities are deemed appropriate because you can be outside and do them, and something like theater or some of the sports that require you to be inside, they're actually deeming as riskier, and they're not able to take place yet. So that's what I think that has a strong factor in why theater would not be allowed, because it's on stage and you guys are projecting out, and you know, the particles would have more of a chance to stay in the air, that sort of thing, versus being outside and running outside and maybe not passing it along as closely.
It's more of the there's a lot of different unconventional things. Like I don't know if any of the committee members are familiar with like theater in the open or certain things like that, but a lot of the students have reached out doing like that. I've had alum that have reached out saying, oh, you guys should rent, they have trailer stages that you can put outside. Like a bunch of people have sent me really weird theater. But it's out there and they keep on contacting me about it.
They're creative. They're not weird. Those are all creative ideas.
They're creative ideas, and I fully support looking into them, but
yeah.
they're out there. They're willing to they're willing to stand on a field and just talk into a microphone at this point. It's just one of those
I can
things.
appreciate that.
So just to confirm, so music theater can only happen outdoors. So regular theater can happen indoor with the 6 feet distancing with masks, and actually then phys ed classes without masks need to be 10 feet or can be
They
6
can
feet
also occur indoor.
Yeah, so it's the music along with choir and any woodwind instruments, which there's also several raging debates about how much air actually goes through woodwind debates from our favorite
I've read that
instrumental
one too.
teachers. Yeah. The challenge is try and blow out a candle through a trumpet. What do you call that? A mouthpiece. Apparently it doesn't happen, but yes.
Things I would never have thought to try.
Me either until 48 hours ago.
All right. So Friday, what time? Oh,
Melissa,
sorry. Go ahead, Paul.
It's 10:30. I just want to practice something. I'd like to make a motion for executive session. I'm just practicing.
Yes, I appreciate that you're practicing,
Practicing.
and that's the direction I'm heading, but we need a meeting time for Friday, and I was going to suggest that it be earlier than 7 so that, you know, we can actually have a little bit of a break. So I don't know if anyone has a strong preference or a time that you get out of work that you need it to be later than, but I would love to go earlier than 7 o'clock just to give people a night.
Just to be clear,
Norsa, when's the commute?
Sorry.
Oh, go ahead. Go ahead,
This
Paul.
Friday the 7th?
Yes, Friday the 7th, sorry. Tina, go ahead.
Never mind. I was gonna just I was confirming what time this Friday the community call was at.
Oh, it is at
11
10
a.m. 10:30.
11.
10:30.
Oh, 10.
Yeah.
Okay.
Yeah,
Right.
10 to 11:30.
10 to 11:30. Okay.
All right. So we're talking about next Friday.
Yep. So the middle school is tomorrow at 11. The high school is tomorrow. Oh, hang on, that's not the right one. The high school is tomorrow at 7. And then the community one is Friday at 10.
For next Friday, I'd like to suggest if we can be efficient and possibly if enough people are free enough to do a midday lunch meeting. So for those that are working, if we can try to incorporate it into a 90-minute lunch meeting, I know that's my suggestion because that's just my suggestion.
Okay. Does anyone who work have an issue with that? Because I don't want to sacrifice a quorum to put it earlier in the day, right? Or sacrifice any of your participation to put it earlier in the day. Does anybody have a problem with doing like what did we say? Did you say noon, Tina?
Yeah, I'm thinking for any of those who with working schedules on Friday that would probably make the most sense.
Brian, could you do?
So this is the 7th?
7th.
Yes.
Yes.
Middle of the day is yes.
Linda?
I would
Lost
not
you
be
on
able
the
to
screen.
do it.
You can't do that. Okay. What's the earliest you can do, Linda?
The earliest I'm home is 4:30.
4:30. Could everybody else do a 4:30? Kaylee?
I know I'm not a member fully of the committee. I just wanted.
You're an honorary member.
If there's a weekday, or honestly any day at all, the likelihood of me being able to come during the day is very low because I work on boats, so I don't have cell service for the majority of my shifts. So it's not like I could call in.
Yes, fair. Would a 4:30 work for you if we were able to? No. How early?
I normally don't get off until about 6:30. So.
Oh, 6:30. Okay.
Yeah. So like even tonight was me running home, and that was why I was a little bit late. Was because of
fair.
I can always watch the recording at another time.
Okay, and catch up with us on Monday, maybe. Linda, do you have a hand raised? Is that?
Oh, I didn't unraise her hand.
Oh, you didn't unraise her hand.
Back on the job. Got you, Linda.
So I'll go back to a 4:30 on Friday. Is everyone else amenable to doing that? Yes? Seeing lots of yeses? All right, so can we schedule for 4:30 on the 7th, Brian? And then we'll be back for a 7 o'clock on the 10th and keep it all, bring us back to the evening sessions if that's okay.
So Monday the 10th and Wednesday the 12th are both 7 p.m.
Yes.
Okay. And just to confirm, the community forum, the message you sent me, I was going back to check the messages.
Oh.
It actually is posted for 10:30.
Oh.
I'm thinking in your email you meant to write 10 to 11:30, and it was listed as 10:30 to 11:30. So that's the way it's listed. That's the way it went out in the what's that word, email message, and that's the way it's posted on the.
Bummer. Okay, so that's on
page.
Friday.
So that's
Friday.
this Friday's community drop-in is listed as, and it's on the calendar
At 10:30.
at 10:30.
Okay. All right, 10:30 it is then.
Well, the daily news report said so that it's from 10:30 to 11:30.
Yeah.
Perfect. Probably just mistranscribed it when I was carrying them all over. Just paying more attention to the Zoom information and making sure that they match the right days and topics
Yeah.
than anything else. So, all right, sounds good. We'll aim for 10:30 on Friday then, and 4:30 on the 7th, and then on the 10th and 12th we'll be back to 7 p.m. Paul, I would like to entertain a motion from you if I could.
Motion for, we enter into executive session.
Not to return to open session, right? Okay, can I get a second, please?
I'll second that.
All right. Can I get a roll call vote, please, to enter into executive session? Erin?
Yes.
Paul Goldner?
Yes.
Maureen?
Yes.
Caitlin?
Yes.
Paul Lees?
Yes.
Linda?
Yes.
Paul Mayette?
Yes.
Tina?
Yes.
And I'm a yes as well. Thank you all for coming tonight, and I will see you again next week.
So for all those staying in the executive session, we're going to stay in this one.